And which is, I believe it's incorrect and it's in order, Chair, to do that. But Chair, when you look at in this one, Chair, the one from the Department of Education, the person who prepared this particular responses to the committee is the Media and Parliamentary Liaison Officer, and it is not signed by the MEC, Chair. So I just wanted to bring you that one to your attention, Chair. So that is the long and short of my story, Chair. Thank you very much.
Thank you very much, Mr. Ngangeli. So I think, members, that is the resolutions taken by this committee, sent to, after oversight, sent to various departments that belong to this portfolio committee. And we asked a whole lot of questions. We resolved on a whole lot of issues. One, I think we must take a specific exception to the Department of Health. I'm a bit dissatisfied and worried about that department. One, when we're at Pelonomi conducting a site visit, the department was not there. I don't remember seeing the department except the infrastructure directorate of that department. I think that somehow we could understand that. MEC, HOD, and everybody else had to rush somewhere. And even after submitting the resolutions to them in a form of questions, were subjected to this conduct where they now no longer answer questions or did not answer questions. And the same institutions that we visited seem to be in the headlines almost every day. Pelonomi is starting to be a problematic institution, not Pelonomi alone. Perhaps it's because it's a tertiary institution. When you look at majority of the institutions of the Department of Health, particularly those where they issue out services here, health care, I think we're experiencing a whole lot of problems. And I'm going to allow the committee to express itself around the conduct per se of the department, because we can't really, but what we've seen there is appalling. The presentation by the CEO there was a bit, it left our jaws dropped. And there were a whole lot of issues there. But this is what we're subjected to. I'm not so sure. Perhaps we might be lucky today, they might show face and then we take them through. But I think as the committee, we need to express ourselves about this conduct. That's the first one. The second one is the issue here, Department of Education. I'm not so sure if members went through the responses. It's like somebody did not study for a test and everything that sounded like it was a correct answer, they hid it in there. Maybe it's because the person is not the person who's rightfully, it looks like we gave someone a day, go and respond, and the person was not even correctly placed to give correct answers. I'll take an example of the first resolution there, where we resolved that the Department of Education must ensure that all targets are achieved. And the department now answers. The departmental third review strategic review session was conducted on the 24th of January. Is this saying anything about targets met? And if they are met, where is there some form of a documentation that substantiates that at least people are doing something or they are responding to us adequately? Or whether there's this phrase that you might not like the answer, but we've answered. So this is exactly what is happening here. People have answered. I'm not even sure if we should entertain an unsigned report. So I'll let members to go through that. I think I'm a bit satisfied of that, of the Department of Social Development, but there are still issues that I believe members would need to interrogate. So it is up to you if we reject these answers. I'm not so sure what is the correct procedure to go. I'm quite fortunate in my Mr. Mervyn, Chief Whip, Chair of Chairs, legal person. I'm surrounded by everyone who has a know-how. So let's quickly engage on these reports, responses. and perhaps the committee might give a way forward what is to be done. Thank you very much. I'll take hands for that. No one? Honorable Klute?
No, Chair, I think you captured what I was also thinking. Let me just maybe give some input. I think you're correct. My problem is we can now have a tussle with the departments, but there's no consequence management on these issues, and I think that's what's lacking. I mean, for a department not to reply to resolutions and questions, it's actually disrespectful towards the committee and you as chairperson. So, Chair, I think we should maybe send those questions back, but also in our committee reports indicate that we were not happy with the replies we received from these departments, so that it's also captured in our report when we report on that in the House as well. So that's my suggestion. Thank you, Chair.
There's a suggestion, members. I think we should take that. Perhaps at some point somebody must take this. And I've realized even in sittings, Chief Whip, that they're not taking the responses seriously. So perhaps somebody must assist us that we should exercise an effective oversight over these departments. Chief Whip.
Chairperson, I think we need to start with questions that are sent from, or responses from departments. We still have a gray area there where departments would be saying that they've responded, and I don't know whether it's lapse in communication within the legislature itself, to an extent that at some point you don't even know now who's talking the truth, because once you find that lapse in the legislature, even if a person has not responded and would just give a response that we have long responded to those questions, it provides or it lands us in a situation where we really don't know what to do. I think what we still need to do is to improve in the legislature, improve our systems on how do we deal with questions and replies. But secondly, on the issue of oversight, I have a problem, Chairperson, with an approach that we do work. What we do during oversight must have a meaning and impact. And if we feel that our work is not taken seriously by government, either there are two things. Either we review systems that we have in the institution in terms of consequence management on non-performance by government on issues that we raised, or if we have those systems, what are they, so that we don't have a situation where we say, because I have a problem with this situation of saying, let's write a report, we don't do oversight for the sake of it. We do oversight because we want to change the lives of the people. And we believe that the oversight work that we do must in a way assist government where there are lapses in terms of performance, for them to improve. And where they have challenges, they are able to raise them to say, we are well aware of the issues you raised, but the challenges that we have at the moment are this and that and that. And as we sit, we then sit with pride to say, we really are doing work. But if we have the type of a report that we have now, it begs a question: what should we do? And obviously, I would not agree with issues of reports, because reports would still get the same feedback. And I'll then, if there are no better systems of consequence management, we then need to say, flag the matter and take it to our strategic planning of committees. For us to develop a way of what is it that we can do that should be impactful whenever we do oversight work, especially in terms of the site visits. Because the problem I'm having is that portfolio committees of national departments, of national parliament, comes to the province, do oversight, and people run around to react. But with us, it doesn't happen that way. Have we outsourced our responsibility to other people? So I will therefore suggest, Chairperson, that we do something else. If our systems still have loopholes, we must then elevate the matter to the strategic plan, so that we deeply review mechanisms that are there available within the powers we have, so that our work should really be impactful, should augment the work of service delivery. That's my input, Chair.
Okay, no, thank you very much, Honorable Leach and Honorable Meko.
Thank you, Chairperson. I think it is also important for it to be minuted that this is the very first meeting of this committee for the year, and it is now the 20th of May. We have also only had one oversight, where we visited a school and Pelanome Hospital and the SASA offices. I think it is unacceptable. We are now almost a year into our term. One oversight, and the very first meeting for the year is held on the 20th of May. It cannot be. We, for the whole of May, didn't have a relevant program. We didn't have sittings. Why wasn't that time utilized? And I think we must put that on record as well. And it must be discussed with the powers that be. We cannot operate like that. The legislature opened the end of February this year. It means there was more than 2 months holiday period since December that it closed. I mean, if we operate in this manner, how can we expect that others can be held accountable? Thank you.
Honorable Meko.
Chair, thanks. I think I just want to reinforce and welcome the proposals that Honorable Khwaban is making. Currently, Chair, our recourse, and by agreeing to the proposals, one of them is that the retreat to the strategic plan should help us in terms of looking at our approach to issues in terms of oversight. But currently, Chair, portfolio committees must be able to capture all these challenges, especially with regard to, number one, non-attendance of departments. Let me say generally the program of the portfolio committee. In as much as that needs to be guided by the rules, the rules then becomes our recourse, number one. Number two, the reports in the sittings. If departments are not responding, certainly MECs must be held accountable. And the Speaker of the legislature who chairs the sitting, because the oversight work is the responsibility of the Speaker. On the basis of those reports in the sittings, Speaker needs to take a decision by referring these issues to the Ethics Committee. That's a recourse that the legislature has in terms of the work and oversight, and if there's a transgression, if there's a defiance by department. And I don't think we've fully utilized it. Perhaps when we go to the strategic planning, we'd have to overemphasize the importance of these currently available recourse mechanisms. Otherwise, Honorable Khwaban is correct. We will be ticking boxes. Committees will be sitting for the sake of sitting. The core mandate of the oversight of the committees is site visit. There must be responses. Otherwise, even the resources which are utilized when we do that work becomes fruitless and wasteful expenditure because there's no impact. Oversight work needs to have impact. Chair. So I thought I must do that, but we don't necessarily have to wait for the strategic planning. We will go there just to reaffirm and to strengthen the currently available mechanisms. But right now, the committee has a right to compile a report, bring it back, let's adopt it. Clear recommendations that says this is a report that is going into the city. And we expect that the Speaker is going to take action. Thank you.
Thank you very much for the inputs, honorable members. I think we'll explore those avenues. However, we need to improve on a whole lot of things. I suspect Honorable Leach has captured us quite well as the committee, I suspect, to say the time frame is not of the correct nature. Hence, we find ourselves dealing with the reports. I mean, the annual reports of 2023, that's how outdated. We're lagging behind so bad that it's not even funny. And not only that, the issues of the program of the legislature, congested or not, it somehow appears to be deliberate, and which hampers on the issue of oversight and the site visits. And she's correct even to say just one site visit so far is not all right. It can't be. when we are exercising oversight over 3 departments. We can do much more and we can be far more effective. So I think such a report must be compiled, maybe exploring such avenues as the speaker in the ethics committee and the issue study finances. I think that even kwa strategic session, the issue oversight, perhaps it must find proper expression. And that's where we need to ventilate this matter even further. To get a thorough understanding that are we going to be members of the legislature that are so toothless and sent here by our constituency, joining a legislature that is also hamstrung in a way that it should not do anything. It can only do stuff with matters that are so outdated, like the ones that are going to be presented before us now. So one would say that there's a deliberate attempt. Somehow there's a typology running amongst us here, holding us back not to exercise what is constitutionally our rights, both as a portfolio committee, but equally as members of this legislature. So I think we can do better. We can do better. The understanding is finances are a problem, but it cannot be the reason for individual members not to attend their oversight. And here again, I'm worried about that program. So I think it should be captured as such that we'll compile a thorough report, but there must be consequences. Otherwise, we're assisting executive or we're just giving them a leeway not to provide services, not to account anyway to anyone. So I was trying to wrap that up. I see the hand here, Honorable Foko. Perhaps you are the last one, and then we quickly run. Also, part of the issue system, you need to observe time a lot. So you'll be the last one, Honorable Foko. Please be brief.
Thank you, Chair. Chair, thank you very much for this opportunity. Chair, one, it's, that one is from my side, Chair. Why there is this element of undermining the work of the committees. It's not only this committee, Chair, that is undermined by our legislature. It must be clear, Chair. There are other committees that they are recognized, and the answers are answered very well, Chair, without hesitating. And I think, Chair, we must put pressure. As this committee, we must put pressure, Chair. I hear Honorable talked about, answering questions in the House. That is not proper, because you are answering the individual. It must be clear from today, Chair. I cannot answer questions from the committee of oversight. Direct those questions to you as the chairperson. I think it's the element of undermining. And we must be ready for the battle, Chair, from now onwards. Because now, if we allow, the legislature to undermine the executive, to undermine our work, Chair, we are going to have a problem. Because they even said, I quote, they even said in the House, we don't have a right to go to schools, to go everywhere as the committees. That is to show that they undermine these committees. So if we allow that, Chair, we are going to have a problem. Thank you very much, Chair.
Noted, Honorable Foucault. I think we should now quickly get a presentation, I think, from the Monitoring and Evaluation Office. Are they here? Yes. Okay. Perhaps we should move to that stage so that at least we don't waste much more time on what we have all agreed that we must compile a thorough report and send it to correct avenue. Yes, Honorable Member. Just before you come in, perhaps I must make you aware that Chair of Chairs, Honorable Meku, is leaving quite early. There's an emergency go legislature. It seems like there are people who are picketing that side. So a government must respond. I don't know how, so he must go and respond. Thank you very much.
Thank you, Chair. Apologies. I just want to make an apology for Honorable David Masui. He's been admitted to hospital. Our office will just send through a notice. It was just an administrative error, but he is hospitalized. Thank you, Chair.
Thank you very much. That can be noted and sent through. I think it will come as we have discussed. I don't know if that needs, I understood Honorable Klute to have been saying they need to follow correct avenues, so we'll do just that. Welcome, lady and gentlemen. So I'll allow, we don't do, okay. So you are most welcome. I think you are quite aware that we are sitting before the joint committee of both ProPark and social cluster. So you can somehow hammer away. I'm advised that there's no need for you to take oath. So please feel free to present your issues. So for social services, key annual report, yeah, second quarter and third quarter.
Yes.
And then the ProPark,
Second quarter and third quarter.
okay. I think you are briefed. Yeah, but you are briefed about what you. No. Yes. Thank you very much. You will summary introduce yourself.
Thank you very much, Chair. Through you, Chair. My name is Bridumelo Tebani from Office of the Premier MNE. I'll be taking through the Department of Social Development. And then I'll skip through the first initial slides and move straight to the compliance schedule, just indicating that the department did comply with the submission dates. And then moving on to program performance for the annual performance of 23-24. The program is as follows. Administration achieved 100% of their planned targets. Social welfare services, there was 10 planned and 9 were achieved at 90%. And then program 3, there were 14 planned targets, 12 were achieved at 85%. And then program 4 achieved 100% of their planned targets. And then lastly, program 5, development and research, there were 19 planned targets, 17 of those were achieved and 2 not achieved. And in total, there were 60 planned targets, 55 of those were achieved and 5 not achieved at 92%.
Can we quickly rush to the deviations?
To the deviation.
Because I'm also worried that 2023, 2024 is what we've been worried about. We're lagging behind a lot. So even
Alright.
if we're briefed, it's not much we can do.
Okay, through you, Chair, may I just speak to the indicator and then the non-performance and then allow the departments to speak to reason for deviation? Thank you. So with regards to the non-achievement, the first one in program 2 was number of households who benefited from social relief of distress. And then program 3, the first one being number of child and youth care workers providing community-based care services. And then the last one there is number of individual developmental plans for children in CYCs reviewed. And then for program 5, there were 2 indicators not achieved as well. Percentage of funded NPOs monitored for compliance, as well as number of population capacity development sessions conducted. Nothing was achieved from a planned target of 2. And then with regards to some of the key observations, the department achieved 92% of their planned targets for the financial year. And then with reoccurring underperforming indicators, there was none for the department. And then this is just the conclusion that for the annual financial, it's the achievement is at 92%, pardon the first quarter typo there. And then through you, Chair, I will then go shoot straight to the next presentation, which is quarter 2. Again, I will go shoot straight to the compliance, indicating that the department did comply with the submission dates. And then moving on to the next slide, which is the program performance again. In total, there were 46 planned targets, 41 of those were achieved and 5 not achieved at 89%. And then moving on to the non-achievement for program 1, number of beneficiaries reached through social and behavior changes program. And then for program 3, a number of children placed in foster care, as well as number of registered partial care facilities. And then for program 4, the non-achievement, there was number of victims of gender-based violence. And then for program 5 was number of community-based plans developed. There were, for quarter 2, there was 5 planned and 3 were achieved. And then the key observation there is that the department achieved 89% of their planned targets and not achieving 11, which is a improvement from the first quarter's 82%. And then the reoccurring indicator that was not achieved, as well as not achieved in the first quarter and in the second quarter, was number of victims of gender-based violence. And then the conclusion is that the department for the first quarter achieved at 89%. Through you, Chair, you would note that we as the MNE have started now the process of which we are now looking into indicators where there's a continued reoccurrence of non-performance. We have now also started the process of looking into some of the corrective actions as well as the reasons for deviations, whether or not they remain the same throughout the quarters as well. And then moving on to the final presentation, which is quarter 3. Again, the department still submitted the reports within the prescribed due dates. And then with regards to the performance for quarter 3 is as follows. The total indicators there were 47. The achievement was 40 indicators were achieved and 7 of them not achieved. The percentage is at 85%. And then moving on to, this is just a flowchart of how the department have been performing throughout the 3 quarters thus far. And then moving on to indicators that were not achieved in program 2, number of older persons accessing residential facilities, and then number of persons with disabilities accessing services in protective workshops. For program 3, the non-performance is as follows. Number of family members participating in family preservation services, and then number of children placed in foster care. The target there was 125, the output being 121. And then for program 3, number of victims of crime and violence who access support services. And then lastly, again, a number of victims of gender-based violence was also not achieved. The service is voluntary and it's needs-based, as indicated by the department. And then lastly, for program 5, number of community-based plans developed is not achieved. The target there was 9 and the output only being 7. And then the department achieved 85% for the third quarter, not achieving 15%, which was a slight decline from, pardon, the 92 is at 89 of the second quarter. And then to conclude, the department for quarter 3 achieved 85% of their planned targets. Thank you very much, Chair.
Thank you very much.
Good morning, Honorable Chair and Honorable Members and the colleagues. I am going to be taking the committee through education first. Mema Tabane is off sick today. She normally does education. I will start off with the annual report for 23-24 financial year. And with your permission, Chair, I will skip the, why is it not flagging? BBT. I am BBT.
I've been made aware, members, that every presentation that will be here, it's emailed to you. I know we've made provision for the issue of WhatsApp, but it seems like the documents were far too big. So please pick through your email inboxes. There's something waiting there for you, but every presentation in here is emailed to you. Thank you.
This is the presentation, as I indicated, for annual report of education 2023-24. And I am going to skip the presentations the slides that have similar information to the previous presentation, Chair. But just to show the compliance schedule, the department for the financial year under review did comply with all the due dates as prescribed by DPME. And on the summary of the performance of the department per program, the performance stands as follows for 23-24 annual targets. In program 1, they had 9 targets and they achieved 8, which is performance of 89%. Program 2, public ordinary school education, they had a total of 28, achieving 24, which is a performance of 86%. In program 3, independent school subsidies, they achieved 100% of the 3 targets. Program 4, public special school education, they had 4, they achieved 2, which is a performance of 50%. Program 5, early childhood development, they achieved 100% of the 6 targets that they had. Program 6, infrastructure development, they had targeted 6, they achieved 4, which is 67%. Program 7, examination and education related services, they had targeted 10, achieving 7, which is a performance of 70%. In total, the department had 66 targets for 23-24, achieving 54 of those and 12 were not achieved, and the performance is therefore 82%. This is just a graphical illustration of the same figures that I spoke to. And in total, the performance looks like this on a pie chart. And a recap of how the department performed in the quarters. We see that it was at 67 for quarter 1 and quarter 2, and then at quarter 3, they reached 100%. Then in quarter 4, it was 82%. Chairperson, I'm just going to only indicate the indicators where there was underperformance, but not really go through the details because the department will provide such. The first one in administration, it was indicator 103% of education expenditure going towards non-personnel items. And then in program 2, public ordinary school education, it was the indicator on number of focus schools offering technical vocation stream, number of grade 10 learners who participated in stream subjects, and then percentage of learners with access to required mathematics textbooks in grades 6, 9, and 12. The next indicator is percentage of learners with access to required EFL textbooks in grades 6, 9, and 12. In program 4, number of learners in public special schools, and then the next one is number of special schools provided with additional assistive devices. In program 6, number of public schools provided with electricity infrastructure, number of schools provided with new or additional boarding facilities. Then in program 7, examination and education related services, a percentage of grade 12 learners achieving 60% or more in physical science, a percentage of grade 12 learners passing technical subjects, excluding technical, maths, and science, and number of public schools, primary schools, where at least 60% of grade 6 learners perform at level 4 and above in both EFL and mathematics. And a key observation, which is just an analysis or assessment of the performance and also in the areas of the indicators that are showing recurring underperformance, we have observed the following. The department performed at 82%, which is an improvement from the 73% which was achieved in the previous financial year. And in administration, program 1, only one indicator had a recurring underperformance in the period under review. So this recurring underperformance is basically a comparison of the 2 financial years, the one prior to the one that we're reporting on and the one that we are reporting on, which is 23-24. And the indicator was percentage of education expenditure going towards non-personnel items. Program 2, 3, 4, and 5, there were no indicators with recurring underperformance. Program 6, infrastructure development, there were 2 indicators with recurring underperformance, and these are number of public schools provided with electricity infrastructure and number of schools provided with new or additional boarding facilities. Then in program 7, it was the indicator on percentage of grade 12 learners achieving 60% or more in physical science, a percentage of grade 12 learners passing technical subjects excluding technical maths and science, and then a number of primary schools where at least 60% of grade 6 learners perform at level 4 and above in EFL and in mathematics. And then in conclusion, we recommend for the portfolio committee to note the performance of the department for 23-24 financial year as follows. Program 1 achieved 89% of their planned targets and 11% was underachievement. And program 2 achieved 86% of their planned targets, and 14% was an unachievement. And in program 3, 100% was achieved by the department, and in program 4, they achieved 50%, and 50% also remained unachieved. In program 5, there was 100% achievement of the planned targets. In program 6, there was 67% of the planned targets being achieved and 33% not achieved. In program 7, 70% achieved and 30% not achieved. And in total, the department is sitting at a percentage of 82%. That's a typo, should have put the percentage mark there for 23-24. And that will be all for the annual targets. Then, Chairperson, I will just shoot straight to quarter 2 for education. And I will zoom straight to the compliance schedule. The department for the 2 quarters leading up to second quarter, which is quarter 1 and 2, has been in full compliance with the due dates prescribed by DPME. And the performance in summary for the department in quarter 2 of 24-25 financial year, it was as follows. In program 1, they had 3 planned targets and they achieved that, which is 100%. They had nothing planned for the quarter under review in program 2. Then in quarter 3, independent school subsidies, they had planned 1, they achieved that one, which is 100%. Then in program, so why is it not? It's not moving. I guess it's me. Should I just continue, Chair? Oh. My apologies for that. I suspect it's me who does not know what to press.
We're moving paperless, so would like to administer that you also improve your gadgets to be compatible to the legislature system as well. So not only skills are to be blamed, but equally I suspect, like Chief Whip said, gadgets are problematic also. So you're carrying around a computer with a DOS program there. It's
Thank you. Program 5, there was nothing planned. Program 6, there was nothing planned. Program 7, there was nothing planned. And in total, the department had planned 5 targets for the second quarter, and they achieved all 5, which is 100%. I must also I don't know whether it's not re-emphasized, but I think as we would have done in previous quarters or in previous times with education, that it should be noted that their APP, how it's structured, mostly their indicators, they have targets for the fourth quarter or annual targets, not throughout the year. So it will be very few throughout the year, quarter 1 and quarter 3 mostly. It will be the fourth quarter. Then on the next one, it's just a graphical illustration of the performance and the pie chart. No. IT, this is still failing me. Something is not. I'm seeing a different slide here and it's not moving there.
I think so.
nako tse dingwe unfairly blame the Office of the Premier Monitoring and Evaluation Directorate. Khanti the actual thing that is outdated is the system legislation. You can never be too trusting with these things. So who must reassess when she says that her computer is 3 months old? So if you're ready, you'll just indicate it
Thank
when
you,
you
Chair.
proceed.
I'm going to continue.
Thank you very much.
Thank you. So the pie chart is 100%, it will be all green. And key observations, because there's nothing under, which is underachieved, and there are no indicators with recurring underperformance. So if the quotas, there's very few indicators, chances are there will be very or none, recurring underperforming indicators. And in conclusion, I make the recommendation for the Portfolio Committee to note the performance of the department as follows. Program 1 for quarter 2 of 24-25, Program 1, 100% was achieved. Program 2, there was nothing planned for the quarter. Program 3, independent school subsidies, 100% achieved. Program 4, public special school education, independent school subsidies, 100% was achieved on their planned targets. Program 5, ECD, nothing planned for the quarter. Program 6, nothing planned for the quarter. Program 7, nothing planned for the quarter. And in total, the department achieved 100% for their planned targets. Thank you. Then I am going to move to quarter 2, Chair. Quarter 3, my apologies. Let me just close this. And quarter 3. Come. Okay. And in quarter 3, we continue with the compliance slide, and the department has been complying also even for the 3rd quarter. And the summary of the performance of the department per program, it looks as follows. Program 1, administration, they had planned 3, achieving 1, which is a performance of 33%. Program 2, there was nothing planned for the quarter. Program 3, 1 was targeted and it was achieved, which is 100%. Program 4, 1 targeted and achieved, which is 100% performance, and nothing was planned for Program 5, 6, and 7. And in total, the department had planned 5, they achieved 3, which is a performance of 60%. That's just a graphical illustration. And the programs where there was nothing planned, they will remain blank with nothing on them. Then in total, the performance of the department is 60%, which is achievement, and 40% underachievement. A recap from quarter 1 to quarter 3, the first 2 quarters, it was 100%. Then the 3rd quarter, it dipped down to 60%. And that is the areas where there was underperformance, which is in Program 1, a number of schools that use the South African school administration and management system or any alternative electronic system to provide data. The next one is number of public schools that can be conducted electronically. And the key observation is that there were no indicators with recurring underperformance for the quarter under review. And in conclusion, I'd like to make the recommendations for the department, for the committee to note the performance of the department as follows. Program 1 achieved 33% of their targets and didn't achieve 67%. Program 2, there was nothing planned for the quarter. Program 3 achieved 100%. Program 4 achieved 100%. Program 5, 6, and 7, there was nothing planned for the quarter. And in total, the department achieved 60% performance. And that will be all for education, Chairperson. Should I move straight to health? Should I open them one by one and then do the slideshow? Chairperson, at your guidance, should I move straight to health? I am now presenting Department of Health's annual report for 23-24 financial year. And I will try and not do everything. And looking at the compliance, the department complied in the 23-24 financial except for quarter 2, but for the rest they did comply. in terms of the due dates. And for the annual targets, the performance of the department is looking like this for 23-24. Administration had a target of had 19 targets. They achieved 8, which is a performance of 42%. Program 2, they had 66, and they achieved 31, which is 47% performance. And then EMS Program 3, they had planned 7, achieving just 1, which is 14% performance. Program 4, they had 20 planned, they achieved 9, which is a performance of 45%. Program 5, they had targeted 24, achieving 15, which is a performance of 63%. Health Sciences and Training had planned 11, achieving 5, which is a performance of 45%. Healthcare Support Services, they had planned 5, and they didn't achieve 4, which is a performance of 80%. And Health Facilities Management, they had planned 2, achieving that 2, which is a performance of 100%. And in total, the department had indicators with annual targets that totaled to an amount of 154. They achieved 75%, 75 of those, and 79 were not achieved, which is a performance of 49%. And that's as a graphical illustration. And Chairperson, with health, I am going to skip the part where we are zooming in on the indicators. However, I'm going to speak to the observations that we have made as we looked into the performance, which did in, let me see. Okay, no, we didn't do that for them. But Chairperson, I don't know then whether should I really go through all the indicators?
No, I think that financial year is a bit problematic. So if we can speed it up to the next one, I think
Okay, thank you, Chair. I will then move to quarter 2 of Department of Health. I did click on the slideshow.
I'm worried about the time we are spending with monitoring and evaluation when we're having a ProPAC coordinator also to present. So I just want to check with members, are you able to follow through your gadgets, the presentations? Because I want to bypass this, the marangrang a re bapala. Because the stop and go because of technological issues is really consuming our time now. I think whoever drafted the program, joint committee effect was never taken into consideration. We're having the same time we're having as when we're just a single committee. We should be having 2 hours a session here. If you're ready, you'll just indicate me.
Thank you, Chair. I just want to highlight a typo at the top in terms of how I saved the presentation. It says 23-24, however, it is 24-25 as per the presentation in the slides or the content as it indicates. So I am doing Q2 of a Department of Education for 24-25 financial year. The department did comply fully, and zooming in on the performance of the quarter of the department for the second quarter. In administration, they had planned 9, achieving 5, and in district health services, they had planned 58, achieving 32, and then in program 3, they had planned 5, achieving 1, in program 4, they had planned 13, achieving 11, in program 5, 16, achieving 11, and in program 6, they had planned 5, achieving 4, in program 7, they had planned 6, achieving 4, and in program 8, they had 1, and they didn't achieve that one. And in total for the quarter under review, the department had 113 targets, achieving 68, and performance therefore translates to 60% and 40% under achievement. That's just a graphical illustration. Then on a pie chart, in total, the performance is 51% green and 49% in the red. And with this one, Chair, I am going to skip and go straight to the slide on key observations. Okay, there we are. So the key observations basically is an assessment of the performance of all the indicators that in the previous slides in terms of the underperformance, and we looked at, as my colleague had indicated, that we're now zooming in on indicators with recurring underperformance, and we looked deeper into that. And in program 1, there were the 4 indicators with recurring underperformance, and they include this. They include the percentage of invoices paid within 30 days, and also revenue collection. In program 2, district health services, most indicators negatively affected by delays in seeking care by pregnant women, as well as delays by caregivers in seeking medical attention for young children. So these are indicators that are relating to children health. Mostly those are the issues that hindered the reaching of targets. And also the lack of integration of services is also a common reason for deviation in the above indicators. And then in indicators related to HIV and TB management, they are mostly affected by issues such as high rate of loss to follow-up, non-adherence to treatment, as well as high death rates, especially for the TB indicators, and lack of knowledge about TB disease and importance of treatment adherence. And then in program 3, personnel challenges, including shortage of skilled personnel in EMS, hampered achievement of targets in this program. The department also indicated HR processes appointing were not yet finalized. And then in program 4 and 5, same reasons for deviation as reported in program 2 were prevalent for child fatality rate indicators in these 2 programs. So basically, so far, 3 programs showed poor performance on child fatality rate indicators, and similar reasons are given for that underperformance. Then program 6, no indicators with recurring underperformance. Then in program 7, the one indicator with recurring underperformance is service level for normal orders, which was affected by factors such as MedSAS, which is a system crash, which also affected placement of orders, suppliers not delivering stock due to a number of challenges, including active pharmaceutical ingredient unavailability resulted in suppliers not delivering, and quality-related issues. Then, in conclusion, I would like to make the following recommendations for the portfolio committee to note performance of the department for quarter 2, 24-25 as follows. Program 1 achieved 56% and 44% was not achieved. Program 2 achieved 44% and 56% was not achieved. Program 3 achieved 0% and 100% was not achieved. And then program 4 achieved 45% and 55% was not achieved. And program 5 achieved 27%, whereas 73% was not achieved. And program 6, 100% of their targets was achieved. And program 7, 40% of the planned targets was achieved, 60% was not achieved. And program 8, which is the last program, achieved 100% of their planned targets. And in total, the department's performance for quarter 2 is sitting at 60%. And thank you, Chair. That is all for quarter 2. I'm now going to move to quarter 3. I opened the wrong one just now. I must close that one. You can close it. Let's open this one. Yes, quarter, just scroll, yeah, quarter three, it's correct. Is it? I'm now on quarter three of 24-25 financial year, and I am going to just get to this one where there was full compliance by the department, and summary of the performance of the department as per their programs for quarter three of 24-25 is as follows. Program 1, they had planned 9, achieving 4, and program 2, they had planned 60, achieving 38, and program 3, they had planned 5, achieving 1, and program 4, they had planned 13, achieving 7. Program 5, they had planned 16, achieving 13. And program 6, they had planned 5, achieving 3 of those. And program 7, they had planned 6, achieving all 6. And program 8, they had 1 and achieving nothing against that one target. And in total, the department had 125 targets, achieving 72 of those, and 43 were not achieved, which is a performance of 63% for the period under review. That is just a graphical illustration. And again, Chair, I am going to skip and speak straight to the observations. And with the key observations, the department's performance has been on a steady incline from 56% in quarter 1, 60% in quarter 2, and 63% in quarter 3. And in program 1, only one indicator recorded recurring performance, and this is the indicator on invoices paid within 30 days, so far in all 3 quarters. And in program 2, majority of indicators showing recurring underperformance from quarter 1 to quarter 3. The assessment is as follows. Indicators relating to child under 5 death rates due to reasons, various reasons such as late representation, severe malnutrition, and severe prematurity. Indicators relating to HIV and TB management mostly affected by high rates to follow-up, non-adherence to appointments and treatment for both children and adult indicators. And TB indicators mostly cite lack of knowledge about the disease and importance of treatment adherence. Indicators relating to child immunization affected by a limited number of days in which some clinics offer these services. So what this begins to do, Chairperson, is basically highlighting the areas that are stubborn for the department for this particular financial year in terms of the performance, and also the issues that are the reasons, mainly the reasons behind the performance of these particular indicators. So it becomes important then to zoom on the reasons for deviation for the department, and maybe for the committees also to just check if indeed their corrective measures are effective, or are they maybe even slow in implementing those corrective measures, because that most likely indicates that if there is such stubbornness in the performance, then we need to start zooming in on such factors. Continuing, Program 3, Emergency Medical Services, personnel challenges including shortage of skilled personnel in EMS hampered achievement of these targets, and lack of capital and maintenance budget was also cited in rostering of obstetric ambulances. For the longest of time, I think this has always been the reason in Program 3, for example, in line with what I've just said. Program 4, Provincial Hospital Services, 2 indicators recorded under recurring underperformance, and these are inpatient bed utilization rate and patient safety incident rate, case closure rate, both in specialized and psychiatric hospital services. And then in Program 5, Central Hospital Services, Severity Assessment Code, 1 incident reported within 24 hours is showing recurring underperformance in quarter 1, 2, and 3. And then Program 6, Health Sciences and Training, number of nurses trained in NIMAT in quarter 2 and 3, there was underperformance. Then in Program 8, 1 indicator with recurring underperformance is the one of percentage of facilities that have undergone maintenance affected by budget, and the issue there is the budget constraints. In quarter 2 and quarter 3, the department has reported underperformance. And in conclusion, I would like to make the recommendation for the committee to note the performance of the department as follows. Program 1, 45% of their planned targets was achieved, 56% was not achieved. And then in Program 2, 63% of their planned targets were achieved, 37% was not achieved. Program 3, 20% was achieved, 80% was not achieved. Then in Program 4, 54% achieved and 46% not achieved. In Program 5, 81% achieved, 19% not achieved. Program 6, 60% achieved, 40% not achieved. And in program 7, 100% achieved. And then in program 8, nothing was achieved, and therefore performance is at 100% for this particular program. And in total, the department's performance is sitting at 63% for the third quarter. And that is the end of my presentations, Honorable Chair. Thank you.
Thank you very much, the monitoring and evaluation team from the Office of the Premier. I think before we squeeze in the departments, maybe the coordinator, ProPEC must also somehow away with the presentation. And as and when we engage, no, let's engage this one, and then we'll call in the presentation from the proper coordinator. Perhaps we need to have an understanding. This information, when it's gathered, do you rely on institutions to supply, or do you also go there and verify certain things here?
Thank you, Chair. We don't do physical verification. However, according to the system of DPME, which is, by the way, a national system that all departments at national and provincial government level use the same system, by the time the system closes and the last stage is the sign off by the HOD. And the expectation is that by the time the HOD signs off, it means the HOD is actually authenticating the information that is provided. But yes, verification would normally be another step that an oversight body would do, but at this stage we are not doing that, Honorable Chair.
Thank you very much, members. A quick one, Chief Whip.
Chairperson, I'm just worried. The performance of the Department of Health and what we observed through the site visit to one hospital, both the two, talk to each other, are compatible. Sometimes in presentations like this, where physical verification is not done, you get the true reflection being hidden under figures. But here, even figures cannot hide the poor performance. And I'm not a statistician. If I was one, I would probably come with a formula that might even bring down the figures that you see here. You may find truly that the true figures, it's about 40% performance and not 63. It says a lot to me. And in relation to what is being flagged as serious challenges, it's also those diseases that you say, how do we term them? Poverty, what diseases? Like tuberculosis and also when you go to emergency, to EMS, if you say you still have a problem with upstairs ambulances, you are simply saying, because obviously for upstairs ambulances, it's ambulances that serves areas that do not have adequate health facilities. So it means it's poverty-stricken areas. So in essence, our Department of Health is doing disservice to poor people in the province. It's no accident that you you saw the figures that they say children under 5, severe malnourishment. Now, what do we say? Because last time we talked about cooperative governance. We have just received also a presentation for the Department of Social Development. What is this department, both the two departments doing, working together to deal with the challenge of severe malnourishment? If you say severe malnourishment for a kid under 5 years in South Africa, where social security also has services to deal with poverty or nutrition for kids from birth. What happens? I mean, I'm just worried with what we are doing in government. We have policies. We have systems, but it seems that we don't see much coordination and work done to implement. I really don't know. This thing really is depressing. It's, you know, what has just been flagged out now. It's depressing. What type of government are we? I don't know what to say. I don't know what to say, Chairperson, but I don't know whether do we still have to, do I still have the energy to come and listen to the Department of Health specifically? I don't know. Now, on the issue of the Department of Education, I think there are two programs that are also worrying. It's a program 2 and 5, ECDs and public ordinary schools. Or is it ordinary public schools or public ordinary schools? There's also poor performance there, or not poor performance, no plans for the quotas. But when you see the plans for private schools or private whatever, it's 100%. What type of government are we? So political economy of education, political economy of health. It's really a problem for us. I really think that we really have to do something, to really do something for, maybe to have things turned around. Thank you, Chair.
Yeah, Honorable Leach, I suppose you'll be the last one. I'm observing time. As and when you answer to the questions, couple concerns, the Honorable Khwabane, perhaps one should also have a thorough understanding. After recommendations, whether followed or not, what then is done? Perhaps if monitoring and evaluation realizes that there's resistance in a specific program, there's no improvement whatsoever, despite your recommendations and your observations to a specific program, what then is done by the Office of the Premier? Thanks. Honorable Leach.
Yes, linked to what you have just mentioned, the Office of the Premier is, the buck stops with her and it stops with your department because she is the overall person that has to implement the recommendations and has to take action if those recommendations are not met. Furthermore, the Departments of Health and Education are the biggest contributors to our budgets. What is that saying if only 60% of targets are met? And I want to also add to what Honourable Khubane has said in terms of the schools, because I know he mentioned private versus public, but one can also mention where there are fees paid, school fees paid, and where there are no fee schools. And it says to me that there's a disregard for the implementation of targets at non-fee schools. And I think it's very important for government and for the departments to realize that even though they are non-fee schools, it is still taxpayers' money that funds these schools. So it might not be directly the parents that pay, but indirectly they pay through taxes. And it is the public's money. In fact, there should be a higher standard for the implementation at non-fee schools. Thank you.
Thank you.
Thank you, Honorable Chair. Yes, we would like to acknowledge and thank the committee members for the comments and inputs. I think we do take note of the areas of concern that are raised by the honorable members. And in terms of the questions, I think in line with the what do we then do if we see areas where there is stubbornness in the improvement or lack of improvement in the performance. Honorable Chair, I think from our side, this part where we take reports to legislature, for us, it's also part of, strengthening the accountability. For us, we come to the committees also with the hope that this is another layer and level where we take things further. I'm saying this also with the knowledge that in the country, if we're not the only province, I think we are very few that we take the performance monitoring and reporting to this level. Mostly it ends in the system and DPME does the assessment and they give feedback to the OTP DGs. I don't know what then the OTPs will then do that information. But where we have another layer where we take it to an accounting a body like legislature, I think for us as MNE, that's another level where, when departments come, we have an understanding that they come here to account and also respond to what we are seeing and what we are reporting as part of what we've analyzed and unearthed in our analysis. Therefore, the expectation would be that maybe even from this angle, there would also be some recommendations for departments to then say, despite, the raising of your underperformance, seemingly now, there's now zooming in and seeing an identification of the fact that there are areas where there is absolutely no improvement. But from the admin side of things, when we are at work, we've also started a new process where we are for this financial year, where we are going to do reviews, where we are going to call, as OTP, we are going to call departments and flag their performance and expect them to also account and there and then maybe devise, other ways of how we are then going to deal with this. Because us reporting, when I say us, I mean the departments, reporting on the same things over and over again, seemingly it's not working. Therefore, what are you going to do? That is also a reaction from our side, from the pressure and criticism that we'd always get from legislature to say we are just a post office. So we really are trying our best where we can to really respond to those kind of criticism and kind of, a discomfort by the committee. But what I'm trying to say is it is two-pronged. There's a side of administration, but also for us, we regard this as another layer of the reporting, another layer of strengthening accountability. So we are hoping that from the side of legislature, perhaps there can be some resolutions that we can also then track together with legislature to say, but this was brought to the last level of accountability and it was discussed, it was dealt with, therefore we want to see change. And come next time, let's hear what has happened. Thank you, Chair.
No, thank you very much. I think we can release the monitoring and evaluation, at least from the chair. And then, okay, at least what you can step off the hot seat, but please feel free to be with us. Honorable Khoban is the coordinator around? Oh, yeah. So please hammer away with your presentation as well before we call in the departments. I think the biggest hit is starting to be directed to the departments. It seems like they need to come and give us a clear account of what is happening.
Is it on? Okay. Thank you, Honorable Chair, and thank you, honorable members. Chairperson, it's not a presentation per se. It's just a matter that we want to run by the committee. As we all know, that due to the withdrawal of the appropriation bill and the division of revenue by the Minister of Finance, the process will have to be redone or restarted. So we do have the lock-up session and retabling of the appropriation bill on the 30th of March, 2025, which is next Friday, if I'm not mistaken. Jay is laughing. This process, Treasury has indicated, Provincial Treasury, that the appropriation bill is the same, nothing is going to change. So what we wanted to suggest I've discussed it with the chairperson, that instead of sort of reinventing the wheel, of starting the whole process and going through all of it, because it is the same, that we instead request all departments maybe to confirm in writing that their budgets also did not change. Maybe we can look at that route. And through you, Chair, yes. The report was tabled, and I think the process that was still outstanding was the second and third reading during those budget processes that were taking place of all the departments. So through you, Chair, maybe honorable members can further engage on that. Thank you.
Okay, I'm not sure if Honorable Khawade, the matter, Yena, and I think it's an overarching matter. I'd also would want to understand from the legislature how were we made to debate on the money that's not there, because it looks like we're going to rerun the same thing. But that as it may, I want us to defer it. I don't know to which level. Perhaps members can assist. Honorable Leach and Kiwanaka, perhaps before you come in, Honorable Leach, let's give the chairperson of that portfolio committee, and then you'll be the last.
Chairperson, I think this is as simple as what is being explained. The only problem that we have is that the processes of legislature must be adhered to. Now, the issue that is sitting in front of us is that when we start the process, it's going to be the same thing, saying the same thing again, because so that's why we then request that there be confirmation to say what they presented to us has not changed, so that we don't rehash and listen to the same thing again. So, but the only, I mean, we could simply say we ended here, let's continue. But the processes of the legislature, that does not work that way. Once the national budget is going to be retabled, starting afresh, even though what allocations to the province have not changed, we still have to do the same thing and restart again. But because nothing has changed, we just want the reconfirmation from them If they don't reconfirm, it means they must come in front of the committee again and say the same thing again.
Noted, Honorable Leach.
Chairperson, if I understand correctly, the national budget is only tabled tomorrow. We don't know whether it has been approved or not. So how can we now already determine whether it's changed or not? There's, and it's already been confirmed that there is no VAT increase. Now, my colleague Werner indicated that it's a 60 billion, right? 75 billion rand deficit. I can for the life of me not see that the money allocated to the Free State will stay the same. So I think we're jumping the gun a bit. Let's see what happens tomorrow. Let's hear whether the budget that is allocated to the Free State remains the same, whether the budget is indeed approved tomorrow or not. And then if it is indeed approved and it stays the same, then I agree we don't need to go through the whole process again. Then we can have our meeting next week, Friday, just to confirm, and that they then present to us that it has stayed the same. They don't have to go through the whole budget again if it's exactly the same. And then, yes, where the departments did not, if it did not change within the department, I don't foresee that we even have to have those same debates on the departments again. We can only continue with the departments where we already, where it's still outstanding. Then we can continue with that, those debates. But let's see what happens tomorrow, and let's take it from there. And yeah, let's keep our meeting on next week, Friday, and then the process can go ahead. Thank you.
I think we jumped the gun a long time ago by starting the processes, the legislature. Understandably, legislature has got its own processes, but which are interdependent somehow onto the processes, National Assembly. So in a way, I'm not sure what's happening here, but it's confusing that we had to get our allocation first and then debate on it. Although the same processes, the legislature would not allow that because of a specific time frame that needed to be satisfied. So there's some form of a confusion that the legislature in the Free State is confusing itself, and it's assisted to do so by the National Assembly itself. So in a way, we're in a serious conundrum here, and we are seen as people who don't know what we're doing. But Honorable Chief Whip, I think I agree that let's not be too forward, because we have realized what that did to us I'm not so sure which avenue to take. Honorable Khobane?
No, it's not what we are saying are not contradictory. Maybe it's a question of anxiety. We are dealing with something that comes from government, not from parliament. So if government says those allocations have not changed, it's them who must confirm to us, not us confirming for them. That's what we are saying here. Because what is tabled tomorrow has already been discussed by them. That's why we are saying it's just for them to it's not to say confirmation is going to come today. You get the point. It's not that confirmation is going to come today. It means confirmation that they're going to make, is based on what is going to be presented tomorrow. The only thing that we are requesting is that if things have not changed, they must just confirm in writing, so that we don't rehash this thing again, start the same process again. So that's why I'm saying the proposal is not contradictory to what Duland is proposing. It's only that she's more worried about what happened before should not happen again. That's why we are then saying it's them who have been given the budget. So once this confirmation comes, they must then confirm to us that The budget has not changed. What they have presented have not changed. If they can't confirm, then we must then start the process again. Look, Chairperson, even if the budget is presented tomorrow, ultimately, allocations, according to government or departments, it's them who come and present. You see? Now, if anything changes, it's them who must tell us something has changed. It's not as even if we can hear that tomorrow, there's no budget. It's still government which must say, really, there's nothing that we have been given as the Free State. Not a single cent has been given. It's them who must tell us. You get the point? Because we don't know what they are discussing in government meetings in terms of the allocations. It's not a legislation. That's why I'm saying to you, we shouldn't sit and worry ourselves to say the allocation to the Free State has been reduced, therefore departments' budgets have changed. It's them who must confirm to us. So that's why we are saying all those things is for them to confirm formally. If they say, really with the changes, there has to be changes in the budget that we are going to present. It therefore says that the process of committee must start from scratch. That's what we are simply saying. It's just for them to confirm to us.
No, I fully understand what Honorable Kwawan is saying, and I've noted your hand, Honorable Skwevela. But my worry about everything is the platform which this matter is discussed at, where we don't have, we're no privy to the contents, the budget. So that's why that's where the waiting must start. So we must note that this was presented to us, and only at the specific platform should we take a stance and say, no, we concur, we'll continue where we left off, or we change because the direction has now been given by government too. So, Lona, you are eating on my time for sweet nothing.
Maybe unless you say that the matter would have to be discussed only in ProPEC. Now we have a joint committee of ProPEC, and so we are taking advantage of that ProPEC is here and have this. That's why I'm saying to you, Chairperson, the processes, that's how processes are undertaken, you know, through the finance process. Now, changes, whether they are there or not, even if we can sit like this and listen to the national minister presenting the budget, it is this department which must come and present and say, we have been given this much. Even if tomorrow's budget can increase the allocation, it's them who must come and confirm. If nothing is being given to say, what we had thought we are going to give you, now we are not giving you anything as a Free State. It's still them who must come and confirm to us, not what we listen to on TV. They must come and form. Those are processes of the legislature. So that's why we are then saying, that's why I'm saying it's not something that they should respond to today or tomorrow. It's them who must say, really, from the allocation as the province that we are given, what we have presented to you in the committee has not changed, or it has changed, then we start the process again. That's simply that. That's why I'm saying there's nothing that is contradictory from what Meduland is saying and what I'm saying. It's just for them to confirm to us. Are there any changes? No or yes.
So should we agree to wait for the right platform for them to confirm after the government has presented?
Which is the right platform? Because ProPEC is the right platform.
Yes, ProPac is the right platform, but joint committee, I think we're eating on a wrong time completely.
No.
Wabona matters of co-chairing with older people at times. Honorable Squabe, we have now neglected you completely. Now it's chairperson to chairperson.
Thank you.
Your
Chair.
time, Honorable Member.
No, Chair, I think that in light of that tomorrow the budget will be tabled, I think that would not necessarily, if there would be changes that would be made into the provincial budgets, would need the MEC to engage or write to the chair of ProPac to alert if there's such, if the entire provincial or budget or departments that are affected by mainly, I think it would be equitable share and the national grants to in writing to confirm. But if the equitable share allocation and the national grants they remain the same, I would not see it fit that there must be a repetition of a representation of budgets. But just for the MECs to confirm with the chair of ProPac to say that the on what the national minister has tabled, the Free State and this number of departments, they are not affected, and therefore we can proceed with the outstanding budget votes, not to repeat the process. Thank you, Chair.
Thank you very much. That concludes that discussion. Can we move over to calling one of these departments? I think health is the first one. Hi, Banimba. Bona, they are so used to undermining us. Chair. Mahlatsi, the HOD, you are most welcome. I think right away we must somewhat allow you space to, Honorable Ramto. Ke fa wena o ba nkise kana. Now I'm guided differently, or MEC. I must first recognize your presence, okorikaka amabedi, and then we go straight to. I'm racing against time. I know honorable members in they've disorganized me a lot this morning. So the time is yours, MEC. Feel free to take us through.
Greetings, Honorable Chair, honorable members, and the committee at large, and the officials. Chair, thank you very much. Because of time, I will not be presenting any, opening remarks and all that. All I would request is clarity from your side in relation to, we have 7 reports that we must present according to the invite that we received. And we also have a number of questions that were being submitted to us. We do have them, the responses in writing. So we needed guidance that we may just hand them over and consider that if there's follow-up questions, that can be done later. But in relation to the reports that we need to present, we'll need guidance as to how are we going to manage them, because it's quite a lot of information in that. So if that can be dealt with, the team is here, it can be able to deal with the issues. Thanks, Chair.
Thank you very much, MEC. I think pertaining to questions, you are the only department that did not answer the questions in time. These questions were based on the oversight that was conducted in the institution at Pilonomi Tertiary Hospital, and thereafter we expected the department to answer thoroughly, so that these members, when they come to this portfolio committee, they are fully abreast of your answers. If there's a need for follow-up that needed to have been done in their own private time, so that in this meeting there's just an engagement around those answers. That's the first one. The second issue, the reports. I think now the annual report 2023-2024 will just note, so you'll just submit it. I think we must all agree that it's way behind. And based on that, I think I must express on behalf of this portfolio committee that the department is not performing quite well. In fact, in this, all the departments, SHE departments or social services department, your department, MEC, I'm not so sure. If performance is around 60% or so, in a lot of lives are dependent on it, particularly poorest of the poor. We continue to see stuff that's not right from the department, but we'll take note of that report and then continue straight to second quarter report, both financial and non-financial, and the third quarter report, 2024-2025. So if whoever would present perhaps would focus on those and will take them simultaneously, both non-financial and financial reports in second quarter and third quarter. So I hope that somehow it gives light to, because we're also pressed against time. This is a joint committee. At the same time, I think all of us would want to have a sense of how far the department has come, where has there been non-compliance, where you have complied, we'll clap hands for you. But it would seem like a whole lot of programs have not been met, at least to the satisfaction. But be that as it may, I hope the information sheds the light, and I hope I represent members quite well. So I think that assists a lot. Let me see.
Honorable Chair, thank you very much. Yes, it does assist a lot, and thanks for the clarity. Just 2 things on my side. Firstly, we will have to deal with the matter of the questions that have been responded to late outside this engagement, so that is corrected. We humbly apologize for that, Chair, but we'll correct that matter. It shouldn't be happening. But from our side, we were under the impression that the questions came late. So there seems to be something that didn't go well there. So we will deal with that. But the second thing, Chair, the HOD is here. She's leading the team, but she'll then explain how she has delegated the team to deal with respective issues. I think we may, with your indulgence, we may start with the presentation. Thanks.
Thank you, MEC. HOD, I'll then start with you. Good morning.
Good morning, Mira Motiva.
Will you be taking an oath or an affirmation?
An oath, ma'am.
And do you consider this oath binding on your conscience?
Yes, I do.
Please state your full names for the record.
Masechaba Angelina Sising.
Do you swear what you're about to tell the committee is the truth and nothing but the truth? If so, please raise your right hand and say, "So help me God."
So help me God.
Thank you, ma'am. Can you please assist me with the colleagues that will be taking an oath or an affirmation?
Thank you. It will be the CFO and Mr. Oliphant, who's the head of the strategic planning.
Thank you. Good morning, sir.
Good morning.
Will you be taking an oath or an affirmation?
An oath?
And do you consider this oath binding on your conscience?
I do.
Please state your full names for the record.
Christodolos Sava Eleftherio.
Do you swear what you're about to tell the committee is the truth and nothing but the truth? If so, please raise your right hand and say, "So help me God."
So help me God.
Thank you. Dr. Oliphant, good morning. Just next to it. Thank you.
Sorry.
It's fine. Good morning. Will you be taking an oath or an affirmation?
I'll take an oath.
And do you consider this oath binding on your conscience?
Yes, I do.
Please state your full names for the record.
Bakang Oliphant.
Do you swear what you're about to tell the committee is the truth and nothing but the truth? If so, please raise your right hand and say, "So help me God."
So help me God.
Thank you, Dr. Oliphant. Chairperson, thank you.
Thank you very much, Mayor Ramoteva. I think we have, just to confirm one or two. All right, thank you very much. I'm being guided differently here. I understand the department has got two questionnaires, both from ProPac and from the portfolio committee coordinator. So that I think what needs to happen is if we at least base our presentation, so to put it, around answering of those questions, and then there'll be follow-up questions, instead of going through the whole second and third quarter presentation. So that would help a lot, because I'm told researchers have already done their work, and based on that, they have submitted questions to you. And that could cover a whole scope of work, MEC and your team. So perhaps he or she who is going to take us through must base at least touch on the questions coming from both directions. I hope that makes sense. Thank you very much. Yes, MEC.
Thanks, Chair. Just to be sure that I understand you well, so our presentation should be focused mainly on answering the two sets of questions that were given to us. Okay.
You can start with either, or if you can, tackle them simultaneously, but I think the best approach will then be to handle them separately, but you feel free to approach them however. But I'm made aware that the researchers were fully aware of the second and third quarter reports. So as such, they made their work and comprise questions in order to guide this committee to exercise full oversight. So as such, that would also, I think, it appeared as a guiding tool. Instead of presenting broadly the report, when it seems like they have already made our work very easy. Thank you very much, MC. Sure.
Chair, thank you very much. I think we can start. I do have copies of signed responses here. I'm informed that the unsigned have been provided already, but here's the signed version, which I would like to submit, but we'll still keep the same presenters to respond to the issues. Thanks, Chair. I think we can start.
As long as they guide us, which one are they tackling first? Is it financial, non-financial, whichever one? Feel free.
Good morning, Honourable Chairperson. Good morning, Honourable Members. Chairperson, I will start with the questions received on the second and the third quarter financial reports for the department from the Public Accounts and Finance Committee. Chairperson, the first question was regarding the underspending within the health sciences and training and the provincial hospital services programs. What we need to reiterate there is within the health sciences and training program, the department has the funding for the Cuban students that has completed and they have then become absorbed within the process. That funding then was then augmented with the international bursaries. So as the bursary students completed, we are reducing the number of bursaries, and that funding has then significantly been moved in the adjustment budget process to the value of 45 million. That was brought then to the funding for those students now as registrars and so forth. So that would then change the final year-end picture because of that adjustment budget. And then within the hospital, provincial hospital services, the main challenge there for the department is that we work on an imbalance between budget and cash, which I think the committee has alluded to in one of its questions. This is due to the historical unauthorized expenditure. So the department has cumulative unauthorized expenditure to the value of 832 million. What that means is the department technically starts every financial year with that value of overdraft. Now, we're not allowed an overdraft, so by default, that cash of the budget that we get gets us to a positive bank balance. So just to remain in a positive bank balance, there's roughly around 800 million worth of budgeted cash that we cannot use as we stay in a positive bank balance. The strategy to solve that is for the department to complete all its unauthorized expenditure investigations and to submit it through to Provincial Treasury so that they can table it at the PROPAC committee, where that will then either be approved with revenue funding or a direct charge against the vote. In other words, the department would have to surrender out of its future budgets that over-expenditure of in the past. The request to the committee is that as the years have gone by, the department has now had 2 consecutive years of no unauthorized expenditure. So what we'd like to request is where the department has an over-collection of revenue, so over and above what the target was, for that to be offset against the historical unauthorized expenditure. That will then start balancing out the budget and the cash. So the challenge mainly for that program is, as much as we have budget on paper, it's not always cash backed, which becomes a cumulative problem. In terms of just the challenges with regards to EMS services and health facility management. EMS services has an over expenditure with regards to the fleet. That is the main challenge around the ambulance services. And obviously that has led to historical accruals that have been growing. So annually, the budget increase isn't sufficient to cover the costs that the fleet services is going up. So that leaves us with a growing shortfall. Internally, we are looking at efficiency programs to try and limit the costs there so that the budget and the expenditure going forward can balance itself out. But that would be the reason for the over expenditure that you've seen. Through the second adjustment budget, we did table to the committee a request to top up Program 3's funding, and that was subsequently then also approved through the MEC of Finance with Environment. So where we had efficiency programs in other sectors, we then were able to bring it through to Program 3 to assist them. With regards to health facility management, this is in the main the historical overcommitment. The department had a lot of projects versus the budget allocation, in particular the Revite grant. Through the new year, the 25-26 financial year, the department has opted to try and complete all its existing commitments without entering into new contracts. This will allow us then to reduce that historical accrual, and that would then basically even out the trend going forward. So we wouldn't start the year with this massive backlog of accruals, which we expense, and then you'd see it's overspending at the start of the year. In terms of the economic classification questions, in particular around compensation of employees, this is once again directly linked to the cash in balance. So if we top up all the paper budget with warm bodies, we would then be back at an unauthorized expenditure situation. So we need to resolve the one in order to move forward on the other one. However, within that, we are also looking at our own internal savings that we can then surrender to Treasury to minimize that gap. In terms of interest and rent on land, this is for interest paid to certain service providers. Obviously, invoicing is older than 30 days. We usually engage with service providers to understand the situation of the department. However, we do have certain service providers that have charged us interest, and as at the end of the third quarter, this was in the region of about 200,000 rand. We start the year obviously by not budgeting for this. This is not something that we want to spend money on. But through the adjustment budget process, we then move and shift budget to cover any interest that may have fallen due. Obviously, this is if the negotiations with service providers fall short. With regards to transfers and subsidies, as much as we have a straight line norm, so the expectation would be at the second quarter you'd spend 50%, at the third quarter you'd spend 75%. Transfers and subsidies work slightly differently for the department because we have two big transfers that take place in the first quarter, 100%. These two transfers are to the medical depot, so we give them their full 100% allocation in quarter one, which would then obviously skew that percentage trend, as well as the HWCTA. So those become once-off payments in the first quarter, and hence why when you look at the reporting, we are way ahead of the trend based on the 50 and the 75% base benchmarking. But overall, we do account for that, and we know at the end of the financial year, there is no additional expenditure to those line items, so that it stagnates. In terms of conditional grants, there was concerns raised regarding the sluggish spending on the HIV/AIDS grant. This is in the main due to just the processing of payments for NHLS as well as ARVs. We did put a plan in place in the fourth quarter where we managed to catch all of that up, and we closed the financial year with only the March deliveries that were not paid, because we received those invoicing only in April. So it just became part of the normal operating cycle. So we actually managed to clear all the challenges there, and we did spend all the HIV grant by the end of the financial year. We have also looked at what led to that backlog during the financial year and put processes in place so that that does not happen again in the new financial year. In terms of the NHI grant, the backlog or the sluggish spending there is particular around the mental health contracting. The challenge there has been that as per the business plan, to recruit the specialists that we need becomes quite a challenge. This is twofold. Firstly, the rate that we are offering is not attractive enough for those specialists to take up the contracts, which we have then corrected with the new financial year. In the business plan, we've upped that rate from 150 Rand per patient to 220 Rand per patient to make it more lucrative to meet those targets. And secondly, we are looking at the categories such as registered counsellors, which would normally not fall within the grant parameters, where we've asked National for them to be included within the scope of that grant, as they can also assist in providing a similar service, and then we can utilize the grant better within the Free State Province. In terms of earmarked funding, I think the main concern there was you could see a high expenditure rate for Cuban doctors and a very low expenditure rate for international bursaries. And I think that is the adjustment we're talking about, where we moved 45 million from the one earmarked funding to the other one. And this is basically to replace bursary student money to the actual students that have finished, and they are now part of the Cuban doctors, as we call it. It's our own students that have completed studies, and now we've absorbed them within the system and we're paying for their salaries. So we've just changed the nature of the funding from, instead of it being a bursary for a student now, but actual salaries for a completed official, medical official. Then the next question was regarding the slow-moving project under the infrastructure enhancement allocation. In the main, the sluggish progress there is linked to the Pelenomi Disaster Center. So in the adjustment budget, the department received an additional 11.8 million Rand. That was in the beginning of December, and the reporting is by the end of December. So obviously that would also just skew the timing of receiving that money versus expending it. But the main challenge is that that contract ended at the end of December. So the department needs to go through a process to obtain a new contractor through the proper SCM requirements so that we can then go back and complete that project. The reality is, as at the end of the financial year, the department did not manage to spend the money allocated for Pelenomi Disaster Center. In terms of accruals and payables, historically, the department's accruals and payables have been increasing every year, annually. And there was a very big spike from the 22-23 financial year to the 23-24 financial year, to the extent that it increased by over 100%. What we managed to do in the 24-25 financial year is we have managed to reduce the accruals and payables to roughly around 19% year on year. And that strategy was employed by incorporating our cost containment initiatives. So the department has internal cost containment initiatives that are more stringent than the provincial ones. And secondly, we've realigned some of our processes for efficiency gains. So out of that, we've seen that we've got a smaller amount of accruals and payables that we're carrying over to the next financial year. And the technical overdraft is also less. So we've managed to see an improvement in the overall financial picture of the department. We are not where we want to be yet, but we're now heading to in the right direction. Based on our strategy over the next 3 years, we should claw back all the historical overcommitments and accruals, and we should be working on a 1-month operating basis like we should normally. In terms of the revenue collection, the question regarding do we loan money to Lesotho government and things like that, no, we don't. The money we receive from the Lesotho government is linked to patients that are referred from the Lesotho government to us, the Free State Province. This is mainly within the oncology space, and it mainly impacts Universitas and Pelenomi hospitals. Where the Lesotho government does a direct referral to us, we have an agreement with them and we're entitled to claim that from them. Now, what's happened is in the previous 2-3 financial years, they have not been good payers of their debt. However, in the current financial, or in the 24-25 financial year, you'd see that the revenue collection is above the target, and the Lesotho government has really come to the party to assist with that. We closed the financial year where they have cleared all the debt that they've had prior to 2024. So they've managed to pay us in excess of 200 million rand, and they've brought their own individual debt balance from a region of 235 million that they owed the department. They've brought that down to 85 million. The 85 million at the end of the financial year represents one financial year worth of revenue that is due to us. We still have very good engagements with them and relations, and we're hoping to narrow that timing, the turnaround time, even more. But that's been probably the positive in the revenue space. In terms of the road accident fund, we are challenged there in terms of the strict requirements of the road accident fund, in terms of what they consider a valid claim. And some of the challenges that I can just allude to is where you could submit the patient documents from the hospital, you could submit the medical records, you could submit all responding correspondence, insurance, all of that. But, for example, something as small as the police report does not refer to that patient by name, then it becomes a challenge and the claim becomes non-compliant. So there's a lot of role players in the process that we are coordinating with to streamline that. We also have realized that when the Road Accident Fund implemented their minimum requirement directive, they implemented it retrospectively. So any claim that is unprocessed prior to that would still be considered to need to comply with that, which obviously created a problem for us. We are engaging with them to look at alternatives, maybe even electronic systems that can assist with this. And that is one of our strategies in the new financial year, to claw back some of the unclaimed road accident fund patient money that we've incurred. In terms of the budget versus cash flow, I think I've alluded to that. The main challenge there is to go and look at surrendering the historical unauthorized, and that would then solve the budget versus cash imbalance. That would be a twofold approach. One, where we have surrendered money in the past, let it be offset. Where we've over-collected revenue, let that be offset. And the other one is we need to ring fence within our budget available funds that we can surrender back to the revenue fund to offset that. So those would be the strategies, just to bring the cash and the budget imbalance back in line. Due to the value, the 832 million, I think we can all agree that is not an impact the department can suffer within one financial year. That would be too large an impact on service delivery. So we're looking at roughly 100 million a year, which would then take us roughly around 80 years just to claw that back over time. Chairperson, if I can then maybe go to the financial questions for depot, medical depot, or would you like to take the non-financial first for the department?
However you feel comfortable in your presentation, we'll take guidance from you, and thereafter I think I'll somehow take additionals. If there's anyone who would want to add something, we'll open that space for presentation so that members can chip in with questions.
Thank you very much, Honourable Chair. With regards to the medical depot, just some of the financial questions we received around that. The depot's main challenge is the department does not pay the depot within 30 days due to the department's financial constraints, which means the depot cannot pay its service providers within 30 days. So there is a knock-on effect, and there's very much a dependency on the department's financial position that impacts the medical depot. Some of the strategies that we've implemented around that, by reducing our accruals and payables as a department, we've managed then indirectly for the depot to reduce its accruals and payables to service providers. So that same positive trend you can see filtering through year on year from the department through to the depot, through to its service providers. What remains a challenge for us is the processing of invoices. Invoices take place and orders take place at a facility level. However, we capture and pay at a head office level. So it's for us to look at that process and streamline that so that we shouldn't be in a position where while we have cash, we should be settling in time. It's a different conversation if we get to the end of the financial year and the cash has run out. Then we could argue to say, okay, this is the accrual period. While we have cash, we need to be settling that in time. So that is the overall principal challenge. How that impacts the depot is obviously their revenue recognition and their collection is then slightly lower. And secondly, their accruals and their expenditure on goods and services is slightly lower. So by us owing them, it hampers their operations, and that's why you'd see that they are slightly behind their projected trends. In terms of medicine availability, National Department of Health holds weekly meetings with the provincial depots to monitor the supply performance of contracted pharmaceutical companies to ensure that the deliveries are on time and in full. Where suppliers are indicating that there are supply constraints, obviously this is then, there are early warning signs around that, and then the National Department of Health arranges for what they refer to as a provincial procurement quotation, a PPQ, which then allows for an alternative service provider to be used based on the national contracts. So where there is short supply, other alternatives are looked at a national level to see how best to ensure that the country itself doesn't face a burden. And obviously this is also done with regards to ensuring that the alternative suppliers are registered with the appropriate bodies, with SAPRA, and so forth. An evidence-based approach is used in making that recommendation, and also the finance element around that is that we then obviously just need to require that there is available budget to prevent stockouts and elements like that. I think that's where the challenge of us correcting the department's financial position would then assist the depot in the longer term, because that indirectly assists them with their financial constraints. There's also reports that we receive from CETA, and this is also calculating the service level and how that is assisting us. And in the past, that is the qualification we've received at the depot, was where we had a gap in that system. That has been corrected. We haven't had no such challenges in the 24-25 financial year, and we've also been able to do that restatement and correct the cost of sales around that. There were staff challenges due to attrition and retirements around that space as well. This has resulted obviously in certain backlogs and the timing of finalizing dispatch vouchers and so forth. We have looked at other alternative measures to augment that, but the longer term solution is obviously to ensure that those vacant posts are then filled through the proper processes. Chairperson, and then just in terms of questions on the profitability, the depot itself, if you look at the overall profitability of revenue recognition versus cost of sales, does lead to a profit. And due to that, you'd note that the cumulative profit of the depot has now exceeded 200 million. The stance for the 25-26 financial year is that the 40 million that the department has as a transfer payment would then be changed. So the nature of funding would be changed. Instead of it being a transfer, the same 40 million will be then used to settle accounts of the depot. So instead of it being a grant to the depot, it would then be used to offset accounts itself. So you'd see the receivable and the payable would then indirectly reduce by that. The net effect is the depot still gets the full 40 million allocation for that earmarked money. In terms of irregular expenditure, the depot's processes has drastically improved. In the previous financial year, there was no irregular expenditure identified. There was just a slight element of fruitless and wasteful. which was just a late submission to SARS that has been corrected. And in the 24-25 financial year, we've managed to resolve those cases, which then would improve, hopefully, the overall audit report as well in that nature. Chairperson, I think that brings me then to the conclusion on the finance questions. Thank you, Chair. I can then maybe hand over to my colleague to take us through the non-financial.
Thank you very much, Honorable Chair and honorable members of the committee. Regarding the non-financial matters that were raised in the questions from the legislature, I'll start with the annual report. The first question was related to, Honorable Chair, some of the questions have already been addressed by my colleague, and I'll therefore not dwell on those ones. That applies to the first one, that is related to revenue collection, and he has indicated the challenges related to REF, including the fact that the REF had introduced new and more onerous requirements regarding to the minimum information that they needed for them to be able to process the claims from the department. I can just add that the plan is to engage further with REF so that we can make sure that the processes are better aligned between ourselves and REF. And then the payment regarding the government of Lesotho, he has already responded to that, so I'll move on. There was a question related to the PPP, public-private partnership project, and this one at Pelonomi, which was about what are the financial benefits. And there are a couple of benefits that we are citing, that there was a new wing that was constructed, and the private partner also renovated the 8th and 9th floors at Pelonomi. And upon expiry of the contract, this would obviously then become the assets of the department in an improved state. The refurbishment that went with the project, duly noted there, and the benefits also included the increased number of beds, therefore including the increase in the capacity of the department to render the services. On additional revenue, we get a 2% share of net cash variable turnover related to the project, and then the concessionary fees of 150,000 per month. And with regards to the procurement process for the new PPP, the department can indeed confirm that the process has begun. A transaction advisor has been appointed, and the process will be implemented in line with Regulation 16, Treasury Regulation 16 on PPPs. And the department will be able to issue the request for information, for qualification, and this process will indeed lead to the appointment of the new, or rather the re-establishment of a PPP project. There was a question regarding supply chain management and alignment with the needs and demands of the organization. We do note that indeed there is misalignment at this stage, where the supply chain management that is not necessarily linked in terms of the structure, and also the demands for services in the department. And obviously, as we look at improving the structure of the department, we need to address that. But we note also that this could indeed expose the department to a risk of non-compliance, which might also affect our ability to make sure that there is timely availability of resources required for service rendering. There was a question about the gifts and donations, the donations register was submitted with the responses which outlined the the items that were donated to the department, and all the donations were handled in terms of the supply chain processes. With regards to the second quarterly report, the next couple of questions will come, were sent based on the second quarter report. The first one related to payment of invoices within 30 days, and my colleague has responded to that as well. But the key thing is for us to reduce the commitments, accruals, and payables, so that we can indeed meet the standard of paying our creditors within 30 days. Then on the training of staff on the code of conduct, we have trained 3,359, and we also used ICAM, and there was a question regarding what ICAM is indeed about. ICAM is actually an interactive learning, communication, and management system through which we broadcast lessons, and also it can also be utilized for meetings, although in the main it is used for training, so that we are able to reach the employees of the department across all the districts and facilities. And so there is a broadcast studio that is based in Bophelo House that is linked to the different facilities. And the good thing about it, it allows for real-time communication and training of staff, but it also allows for two-way communication between those conducting training and their trainees. There was a question on the audit of leave. There are a number of instances when this is done, including upon termination of service. There is also random leave audits that are conducted by the PERSAL unit of the department. We have the Directorate Human Resource Management also undertake quarterly visits to the districts and facilities. These are mainly intended to make sure that we can monitor compliance with HR prescripts. And then also on a weekly basis, there is monitoring of performance of institutional and district HR offices. In particular, this relates to how leave is managed. Procurement of goods and services from women-owned businesses. And the question was whether it would be feasible for Treasury to review the threshold. Indeed, we note that the implementation guide for preferential procurement regulation of 2022 provides for the accounting officer to define the application of the specific goals. And indeed, we think that in line with that, proper consultation with Treasury would result in reviewing of the threshold. The next question is on primary health care utilization by children under the age of 5. So the question was about the quality assurance that is undertaken to deal with the problem of underutilization of primary health care by the children under the age of 5. So in our facilities, we make sure that children are seen in designated and appropriately resourced consulting rooms. We also implement dedicated streams for mother and child care, and this is in line with the ideal health facility framework. We also implement the mother-baby pair strategy, which allows for the child to be seen when accompanying the mother for any service that the mother could be accessing at the facility, rather than having 2 separate appointments for the mother and the other for the child. We are also linking children, particularly those under the age of 5, to the community health workers, so that as they undertake outreach visits to the households, they can also look at whether the children, for example, in line with the immunization coverage that they should be at, as well as identifying problems such as early signs of malnutrition. Severity assessment code in patient safety incidents. So the question was about the terms of reference, the required skills. Obviously, it has to be people that are familiar with the National Patient Safety Reporting System. Also the International Severity Assessment Code classification that indicates the extent to which the impact, the patient safety incident impacted on the patient involved. And the membership and reporting, this is where the membership includes people that are part of clinical governance as well as safety committees, and this reports to the chief executive officer of the hospital, but the chief executive of the officer also reports to the province on regular basis. So in terms of the rating of the patient safety incidents, what is classified as SEC 1, that's where there could be a death or severe injury that could include loss of limb or crippling of the patient. All these must be reported within 24 hours, but all the patient safety incidents are supposed to be addressed and closed within 60 working days. With regards to morbidity and mortality review rates, the report indicated that part of the problem was related to National Hospital. So the question was then about the project at National Hospital. Indeed, the hospital, the infrastructure projects at the hospital started in 2017, but there was fire damage during the course of 2024. In terms of the progress so far, certain projects have been completed, like the workshop, garage, laundry, mortuary, the doctor's residence, dental clinic, and a couple of other sub-projects as listed there. In terms of the projects that are currently underway, we are at about 40% completion with regards to admission, administration, emergency block, and the external works. Regarding the children dying due to severe acute malnutrition, so the plan to curb this, in terms of our clinicians and other healthcare workers, healthcare providers are particularly involved in the prevention of malnutrition, but also to manage children that could already be malnourished. This involves education and clinical care that must be provided, as well as support that gets given. Amongst others, the assessment of nutritional status that is done by the nurses and community health workers in the main, which includes growth monitoring of young children, as well as measurement of what we call the measurement of the mid-upper circumference of the arm of the child, which is then correlated to the age of the child to determine whether the child is growing and developing physically in line with the age that they are at. Nutrition and education, the monitoring of diets, that includes diets in hospitals, but it also includes advice that gets given by dietitian and other clinicians to patients and community. And community outreach, this is mainly through our community health workers. And then ART, this is about the adults that remain in care. And the question was how we are mitigating the issues to reduce the long waiting times for patients on antiretroviral therapy. And that's the ART. The department is indeed implementing what we call the universal test and treat approach, which means that as soon as the patient is diagnosed as being HIV positive, they are already started on treatment immediately or as soon as possible. And then we implement the booking system. Coupled to the booking system, the files are pre-retrieved so that we try and reduce as far as possible the number that the patient gets to the clinic and still wait for the file. So the patients then are given appointments, and we try and have those files already upon the arrival of the patient. And also there is multi-month dispensing of ARTs, which reduces the number of times that the patient needs to visit the clinic. We do the decanting of patients so that stable patients can access their treatment through their CCMDDs. And in some instances, the delivery of ARVs to the patient's households, which overall then reduces the requirement for patients to visit the clinics. And children, regarding the viral load suppression, so we are asked to explain the collaboration with the Department of Social Development. We have indeed established referral pathways at sub-district and facility level, and this results in the referral of children to the social workers, both in the Department of Social Development and Health. And within the department, we have also appointed 34 social workers that are across the different districts, and that they help a lot in dealing with psychosocial issues related to children and HIV. Pre-XDR treatment success rate. The question was about education with regards to treatment. What we are doing through our health promotion programs, we provide education on different types of TB, including XDR, MDR, XDR, as well as pre-XDR. And the problem with XDR is that it's the complexity, because the patients in those cases are actually already they are already not adequately responding to the 3 or 4 first-line drugs that are normally treated used for the treatment of MDR. Vitamin A dosage, we provide treatment, not treatment, but rather supplementation of vitamin A to children under the age of 5. This is mainly done by the community health workers and professional nurses. So even on outreach, the community health workers do that. And then the number of clients seen for mental health care services. The question was whether the department, what has led to the delays. The delays were in appointing the additional professionals was due to longer approval processes and whether the budget is available. Indeed, the budget is available to the tune of 8.17 million, which is under the conditional grant. The next the next three questions are related to EMS. The first one was, when will the shortage be addressed? We have already started the process of identifying the posts and this will undergo the process of approval, and once the approval is given, we'll be able to appoint the professionals that we need to man our emergency services. And then the EMS operational ambulance coverage, we were requested to explain still the issues of the appointments. We just want to explain briefly that based on the 2.9 million population of the Free State and the requirement of 1 ambulance per 10,000 population, the Free State actually needs 291 ambulances, but we are currently rostering 149. We have 1,523 officials, and in order for us to increase the ambulances to 291, we need to increase the staffing levels from 1,523 to 2,328. So indeed, then the process of appointing additional staff become critical, but this is also linked to the availability of the financial resources to be able to appoint the staff that we need within the budget that we have. And then the rostered patient transport, similar issues regarding staffing, but we just want to indicate that we are also trying to increase the availability of resources, including specialists and tools of trade like diagnostic medical equipment in the districts. And as the resources increase in the district, the need to transport the patients to Bloemfontein, mainly to universities, and to some extent Pelonomi as well, will reduce. And so as the resourcing of the districts increase in inverse proportion, then there will be a reduction of the number of people that we need to transport to services in Bloemfontein. And then the patient's safety incident closure rate. The question was for us to explain the prerequisites for appointment to serve in this committee. There are certain positions where the incumbents, by virtue of them being in those positions, would become part of the committee, and this include the CEO of the hospital, the clinical manager, who happens to be the chairperson of the committee. Each hospital also has the quality assurance manager, the nursing manager. In some instances, you could have, in bigger hospitals, more than one nursing manager, or rather a management team of nurses. And then we also need to have our staff that are involved in infection prevention and control, the complaints manager of the hospital, as well as the corporate services. And those would be the standard members of the, or rather the standing members of the committee. But on ad hoc basis, depending on the cases that have been discussed, it might also be the nursing manager for, or the operational manager for the unit involved, and the clinical heads of the different areas where the incident could have taken place, but also people with expert knowledge regarding the cases to be discussed that would have value-adding contribution to the processes of discussions. Thank you very much. That brings me to the end, Honorable Chair.
No, thanks very much, Dr. Oliphant and MEC and your team. I don't know if there's anyone who would like to add something. I'm particularly patient, Chief Whip, with the Department of Health for obvious reasons. You are now becoming the baby of the portfolio committee, and now that is a joint committee, I think I must be extremely patient. If needs be, even compromise the time allocated to other departments in this portfolio committee. So I must take additions if there are any. In the absence of any, no additions. Okay, honorable members, I think this then becomes your time. You are not limited to the questions asked. This was just a guideline from the research team of the portfolio committee to get to the bottom. We need to be very worried when the department is performing at 60%, more so when we did not have time because of our legislature congested program to get to the depth of what is happening even in the previous financial year. So I think I must afford you enough time. But as and when honorable members are preparing their questions, one would like to understand the MEC and the team that the perhaps issue EMS, where particularly there's a shortage of skilled personnel deployed in these ambulances, let alone the ambulances themselves, absence thereof. How did we get to this level? Maybe we need to be patient and not be harsh to ourselves, but how did we get to this level that a directorate of the department, a specific directorate that is so central to your department, deteriorates to this level without being picked up? Perhaps we need to be taken into confidence of how did we get to that level? And I think this one, the trainings and health services, I'll come to that. I'd like to have an understanding, now that Trump is always on our headlines everywhere, and basic to Trump and everything that comes with it is PEPFAR and US aid. How did that affect your ART program? And if it has been affected, that is, if it has been affected, how far has it been affected, and what are processes in place to mitigate that? Because my understanding is this program is also central. It takes a significant chunk of your budget. So perhaps we need to have an understanding that we don't allow a situation where government just shrugs their shoulders and it's all right. We don't know. We're hoping that God comes through. So perhaps if there is any impact, which majority of our I think constituency believe that there's a serious impact. And the mental health, but I realize that we have a shortage also. And mental health cuts across everything. You go to that maternity where you are forever building maternity there, but I don't want to get into, in Pelonoma, I don't want to get into those nitty-gritties. You get to maternity, you will find a need for a skilled mental health practitioner. Everywhere, even in society, just out there in the community, who are riddled with socio-economic problems such as your drug abuse and everything. How much shortage are we experiencing in the mental health, and what is the plan to mitigate it, and how far is the plan being implemented, if there's any? So, honorable members, I thought as and when you are preparing, I should somehow exploit this opportunity. I'll start that side. I don't know if Honorable Foko is just waving to greet me up by you raising your hand. So that will be Honorable Foko, Honorable Squabel, Honorable Pretorius, and Honorable Chief Whip, in that order. Thank you very much.
Chair, thank you very much, and thank you, MEC wa Lefapha la Health. Chair, I just want to check here, Chair, on a non-payment by the government of Lesotho. Is that 200 million outstanding of what Lesotho owe the Free State, or there is outstanding amount that they owe us? That is my question, Chair. Thank you very much.
Thank you, Chair. Thank you, MEC and the HOD and the team. Let's welcome their responses. Chair, I think that when I read, I think it's Q3, when I read most of the corrective actions that are cited where there's underperformance, it's either the issue is internal or it's external. What do I mean? It's either by internal referring that there must be a training that must be conducted, there must be reinforcement of proper planning or recalibrating systems, and then by external, it then refers to public awareness, public education, and so forth. This most of the corrective measures mentioned on areas of underperformance. And this says that the issue of public healthcare does not, or it is not only the mandate of this department. Perhaps the department needs to start to look at collaborative work. Because if, for instance, you find that some of the issues where there's underperformance, the corrective action that is stated is public awareness, public education, it's including health talks, promotion in waiting areas and so forth. It means that the community needs to know or to be aware about some of the issues that they need to be taken to. It might be or your civical screening and others. But what stands out from my understanding reading this corrective action, it means that both the community and the officials of the department and entire collaborative work, being the stakeholders that are involved in the healthcare sector and other departments, need to have a collaborative approach to say that how do they educate then for the society to be informed about these particular benefits or services that they ought to be able to get, and which they forms part and parcel of the annual performance of the department. I think it calls for a collaborative approach, because alone the department is not going to be able to fulfill those responsibilities, given its capacity and shortages of staff internally. So it's not going to, I think we'll need to look into that. How do we, perhaps leveraging on because on the DDM, given that every district there is there is a hospital and there are forums that sits there. I'm not sure about do we have, or there is the forum that concentrate on have, because you have a forum on safety issues, a forum on economic issues, but on health issues. Perhaps we need to look into that if it's possible. If there is, then it needs to be functional so that there's collaborative work to ensure that the community, while strengthening and promoting internal capacities, the community becomes aware of these benefits that they need to do. But internally, the other issue that I want to raise is still the issue that comes on the staff that goes to vacation leave when they are supposed to be trained. And when you look at that particular performance of the target is 750 and the one that are trained is 211, outstanding is close to 400. I think that the employer needs to enforce, because when you are employed, for you to go to a leave, it must be granted. And this training of employees on issues of grievance, procedural and others, and code of conduct. So there can't be a situation whereby employees, they just leave and they have been approved, whereas they are scheduled trainings that they are supposed to undergo through, and their annual performance target that are known by everyone in the department, including those that are leading different units. So I think there needs to be an improvement on managing who goes to leave, which trainings are mandatory, and people have to postpone. Even if it's festive, if you could not go in festive season, you can go in Easter. Could not go in Easter, you can go in June. I think all the time. But what is mandatory and what appears on the APP, employees of the department and those that are responsible leading those different units, they must ensure that employees, they attend to those training and there is no underperformance of such. I think that goes to also on the issue of morbidity and mortality review, where it says that there's no quorum on those facilities. It's still the same issue of enforcing. I don't know. I'm not sure if should I say discipline or stringent conditions of or employment service or what, but to enforce what is supposed to happen must happen, and managing the leave and rotation of staff. I think that's something that has to do with strengthening the relations or strengthening the condition of employment of basics, and those that are supposed to do the certain particular work that they are tasked, they must do, irrespective of they have benefits of leave and sick leave and so forth. But they have to attend to strict condition on issues that they are supposed to be provided, on capacity building and ensuring that the department becomes effective to deliver the service to the people. Thank you, Chair.
Thank you very much, Chair, and thank you, MEC, HOD, CFO, and other officials. Chair, I'd just like to know from the department, in terms of the triple Ps that is coming to end at Universitas and Pelanomi, when is it coming to an end? What is the status on the process, further update? And then by when are we looking to basically finalize that process? Because, I mean, those are quite a large number of beds in Universitas and Pelanomi that has to be transferred, and that there is that there's not an issue that there is not a service provider at some stage, and we don't have that capacity in the province. I know quite regularly, speaking to people, public and private, that there is a shortage of beds in the Free State, and people have to wait to be admitted. Then, Chair, in terms of the revenue, I do note that the department says there is about 540 million in outstanding patient debts, of which 56 million is from Lesotho, and the Road Accident Fund is 76 million, but it then leaves about 400 million. Is that just for outstanding patient debts? That's normal patient fees that's outstanding, or is there also a bulk block of another entity or something else that's making that 400 million? I just want to get a bit of a more breakdown on that revenue that's outstanding, the debt. Then on the Pelanomi Disaster Center, can we just have an idea? The 11 million was mentioned that was received a bit late in December, but what is the actual progress on that infrastructure enhancement at the Pelanomi Disaster Center, expected due date of completion? And then, Chair, you've also touched on it, But then the maternity ward project that's been outstanding since 2010, if we could just get an update about where that stands. I think that joins cause with the Pelonami Disaster Center, where perhaps a contractor, there's a bit of a lapse. You know, sometimes there's rain, etc. It causes damage, and then the whole process has to start over. That there's that there is actually movement at all times, and not a wastage there. And then with the mental health, the mental health practitioners, there's 8.1 million in terms of the conditional grant. The response was there was a delay in the human resource process. Very critical that we make sure that we don't lose that 8.1 conditional grant funding. We need it. We can see it even when we drive in the streets across the province. At times, unfortunately, that there are people living on the street that need mental health assistance, that need to be evaluated and need to be taken to a center for help. People who are living on the street, especially, that are socially distressed, economically distressed. But the question was there then, the question from the committee was, when will the practitioners be appointed? And then the response was just delays are due to human resource process. But we want to know now where is the process, and when we will be seeing these human resource, mental health practitioners being appointed, and seeing the utilization of the 8.1 million in conditional grant funding. Thank you, Chair.
Chairperson, I think some of the answers provided require a flashback, because we get these answers from time to time. When you talk about the issues, just psychosomatic diseases, you then have this response that there's collaboration with social development, but from the undertone, it's something that apparently is starting now. I'm just saying the manner in which responses are provided when we are seated like this would always be in that fashion, because next time we meet, when questions come, there are no follow-ups in terms of development in relation to answers given. Maybe what we also need to have is a situation where we have interdepartmental approach to getting answers. Because since I've been a member since last year, when I meet this department, if there's a clinical, a person with clinical background, probably is one, or there's no one. And this is a Department of Health. And we talk about these cases that we talk about. We received a report earlier on from MNE, which depicted a depressing scenario for the department. Performance from quarter to quarter, 50-something percent, 60%. And those are figures which were supported by a statement that there was no physical verification, which would mean that probably if you have physical verification, the figures we have there may be misleading. It's something that is, the performance is less than that. I'm really worried, MEC and HOD, because when you get these reports, the reports comes as if there's really performance, and it's not there. We engaged the department on the issue of Pelonami, and there were responses given. The situation is is still the same or it has deteriorated. We still get the same responses. It's worrying, Chairperson. From the MNE, we got a report that part of the challenges of underperformance relates also to the issue of children under 5 years dying from severe malnutrition. And the question was the working relationship between the Department of Health and Social Development. And the response given is that, yes, that relationship is there. So, getting the response, you just think, oh, no, then there's an answer to the problem. But the report from monitoring and evaluation of government is saying that is still a problem. There's still a problem in relation to TB. And when you look at the report, is that all the diseases that are poverty-based are the ones that are where the department is performing very badly. If you look at the situation of Pelunomi, as an example, that picture is also related to the problems of Pelunomi. That works both as a tertiary hospital and a walk-in. A situation where you'd find patients in casualty for 3 days, as if casualty is a ward. And you'll never hear from the report from the department what could be the solution towards that. So that as we meet from time to time, we evaluate performance towards envisaged goal of resolving that. This is just but one example. Now, Chairperson, why this saddens me? I'm a member of parliament representing the ANC. And when that situation happened, ANC is blamed. And members of other parties castigate the ANC because of that performance, as if the ANC is the cause. Now, I really want, especially the Department of Health, to really assist us at management. EMS. It was last year when the department was launching 1 ward, 1 ambulance. It's a year later, there are serious challenges in EMS. Why did you launch 1 ward, one ambulance? So, because politicians come in and out, the management stays. It is that attitude that says, no, they will come and go, we remain. What do you want? Oh, 1 ward, 1 ambulance. Go and launch. A year later, it's 50 wards, one ambulance, from 20 wards, 1 ambulance. The situation has deteriorated because people that come, politicians that come, would not be able to evaluate what was done before and how has the situation improved or deteriorated. Chairperson, so I think we also need to have an approach where, moving forward, as part of ensuring that corporate governance is strengthened, how do you approach primary health care? Primary health care you can't adequately attend to it if socioeconomic conditions of people on the ground are not attended to. That would then mean other departments working together with the Department of Health to deal with the issues that people are raising. I mean, if people are saying you move in the streets, you meet a lot of people with mental health problems. Department of Health cannot resolve those problems. There has to be other institutions that assist the departments to deal with socioeconomic issues that leads to those problems. So if we get a report and it doesn't talk to those attempts, and we just think that clinical attendance to healthcare issues alone will resolve our health problems, will then become a problem. The budget will then be stretched and stretched and stretched. Now, the other issues, this one of the budget of the deficit, that has been there for many years. I think for the first time that in the province that we experience a situation where people are taken from Treasury to Department of Health, it was when the department was subjected to Section 100 by government as an intervention to deal with budget problems in the department. And ever since then, it has been a practice, a standing practice. But the problems of financial management, let me not say financial management, but the debt, arresting the over expenditure in the department has not been achieved. My thinking is that, you know, when you have a target, and the target is what, you know, everyone sings that target every time. From time to time, as you meet, you check how far have we gone in achieving that. But taking that as if it's a normality to say, no, every year we have this type of a problem, we just see how we manage it, will not in the ultimate end resolve the problems that we are seated with. Now, I then ask myself, if we say we have plans, and we then say we have a budget, but this budget, we know that when money gets in, then we must have positive account, but we can't spend the money because we are already on the negative. How are you then going to achieve the plans you have set for yourself? Why are we then setting plans which you know that you can't achieve because you don't have money to achieve them? So I think in a way, I don't know what is it that we can say we can do, Chairperson, but doing oversight on challenges that the Department of Health or the hospitals and clinics are faced with at the moment, I don't know what is it that we can say. They are very huge, and most of the problems are problems that emanate from the social conditions that our people find themselves with, and therefore have to find a situation where our health system have to bear the burden of that. And until we become conscious of those challenges, that we'll never then be able to resolve them. We'll then be mechanical in trying to resolve health issues. I just wanted to comment, not necessarily to ask question, because I don't think that the question will ever bring an answer to the situation that I think we find ourselves in, Chairperson. Thanks.
No, thank you very much. Ladies and gentlemen from the department and the MEC, honorable members who they're already aware. I'm co-chairing with Honorable Khwaban. So I'll let him ventilate as the chair. So I will not take anything from him. However, I'll give space for the department to start answering. Based on that, perhaps you need to take us, MEC and the team. We heard there was a strike open on Friday. I just missed it. I should have been there, actually. There's this myth that I must not enter the premises. I wanted to be arrested on Friday, and I wanted to be in Pilnomi, or deliberately. I was just from Kopi, so I missed. It took long, and I hope no camera caught me along the way. I really raced to get to Bloom. By the time I got here, it was already resolved. I don't know if it's resolved. Perhaps MEC and the team will take us through what was happening there. We can't be hearing of strikes when you're already understaffed and all of that. And not only that, perhaps I must share something with you, MEC, pertaining to mental health and the team. This curriculum that is now in session, R171, of the nurses, replaced curriculum 425. And that 425 was a comprehensive program that would train a nurse to be a comprehensive professional who would deal with anything ranging from community, midwifery, general nursing, and everything that comes with it. And in his first administration, President Trump then threatened that, I think this biggest program here, ART, that has been run in South Africa is quite exhaustive, and it's now tapping into my funds. And then he threatened to pull out. And he did that eventually. When he entered, he issued out executive orders, and part of them affected us greatly. But he prepared us, and I'll tell you how. There was, I think, CPAS, which prepared nurses when they recalculated 425 into R171, because Trump was preparing to pull out, so it should not come as a shock now. So, what he did was we should focus more on what he called then the main burden of disease, which was HIV/AIDS. And as a result, all professionals that are going to come out of the R71 are going to be just generally trained and fully trained when it comes to HIV issues, but not when it comes to mental health. And I'm relating this so that you understand that what we have here across South Africa and in the province, it's a postgraduate program which has no basic at all in mental health. So you're going to experience mental health problems now and into the future, more so when the focus of R171, it's your entire system is now shifting towards primary health care. You might find a professional nurse who says the primary health care, cold face, just right at the entry point and has no clue even how to see, let alone diagnose a mental health care problem. Treatment then becomes something foreign. So it looks like, even if you were to catch them up or this post, you want to give someone code 14 who can't even move a small car. So you train them, go postgraduate with mental health care problems and issues, how to treat, diagnose, and all of that, but they don't have basic. And that becomes a problem that was left. It's a legacy of PEPFAR and USAID. So I thought I must just share that so that you understand how deep-rooted our mental health problems are. But that being said, I don't want to take much of your time. I think we must start with the responses. I'll just take anyone who would want to go first. HOD, CFO, anyone? Honorable Lich, you are the last one briefly, so we gave them space to.
Chairperson, mine is not a question, just perhaps a request that we maybe stick to a time frame. I see it's now 1:45 already and we still have 2 departments. So if we can maybe in short get the responses 5 minutes, so that we can just keep on time if that is possible. Thank you.
Let's proceed with answers. Thank you.
Thank you very much, Honorable Chairperson, and thank you for all the questions that have been raised. I think the presentations tried to cover them a great deal, and indeed there's a lot of shortage of personnel because the department has been for very extensive years under without financial constraints, and with the hopes of finishing cost containment soon, which obviously did not arise due to the challenges of the economy that was not growing. We found ourselves even much longer on these issues. We have noted the issue of the EMS shortage of staff, and it's one of the submissions that we are looking at, firstly by appointing all skilled personnel at the level of their qualifications, and then lastly, getting in new people where the resources allow. Yes, there was an issue of 1 ambulance, 1 ward, but what hampered the idea was precisely the issue of the shortage of staff. So the cars were there, but the people that were operating the staff and resources were not there. So as a result, it didn't assist. But the area of Harib, this initiative was rolled out. And that is one area where we saw an improvement in terms of the turnaround time of the ambulance in the rural areas. So there was definitely an improvement, which we reported on our annual report in terms of the turnaround time around that area of Harib. For other regions, we did not realize that impact, and we were hampered by the resources that were lacking. The issue of PEPFAR, we appreciate it, Honorable Chairperson and honorable members. Yes, indeed, we realized the shortage. The issue of the ARV, the minister has sourced funding. I think it's about 1 billion rand to buy the ARV for the rest of the country, and we will be receiving them as a donation. So everybody who is on the ARV program will still be catered for, regardless of the fact that we no longer have PEPFAR. Yes, indeed, it affected in other resources like your computers, your gadgets, your many other resources which those officials were using at the time. And for that, Treasury has given us a revenue enhancement allocations of about 3 million plus to precisely buy those resources for the officials. And in terms of the positions, we'll see where we prioritize fundings and then be able to deal with the issues and be able to render healthcare services for the officials. Yes, the issue of the mental health, that's where we are not properly resourced. And Chairperson, this is exacerbated by the fact that, and I love it because you also like to go to Pelonomi. Most of the people that goes there, it's youth that are intoxicated with drugs. So we find those that are under drug abuse and whose drugs has really kind of messed up with their mental health, being many than the traditional one. However, being said that, it's healthcare that we need to provide for that, and hence the collaboration, as you have, it was correctly said by Honorable Skobela, with other stakeholders like sports, arts and culture, social development, becomes very, very important so that we are able to remove youth from this monster called drugs and get them engaged with other valuable resources. So it's a point well taken, which we will continue to advocate for in terms of our social clusters, that it gets the attention. Honorable Foko, I think Chris will confirm the 200 million in terms of whether is it what we received last year from Lesotho, or is it what we are yet to receive, although there was an improvement. For the fear of not giving the right figures under oath, I would rather leave it to the acting CFO to quickly confirm it. The training, we took note of that. We will rigorously look at our professional development plans and make sure that during the time that the officials are supposed to go on training, they are there and they are not on leave. We have already done the leave audits, which we believe we will draw a lot of lessons and will try to see patterns in terms of those leaves, and then move training on the days that traditionally officials would love to spend with their families, and to other days where they will be available, but even service delivery will not be compromised. The triple P, it's one that we are looking at, but what is going to be a big mountain to climb with the triple P, it will be resourcing. The building, that's something that we can get, but resources in terms of the staff that needs to work there and render healthcare services is what we will have to look at. I think maybe we can request through our MEC that we perhaps give a comprehensive response on this based on our feasibility study, which we are doing with the support of National, to say where are our resources can take us, and where our resources are not going to accommodate us, then we can see what kind of proposals we are able to put on the table so that healthcare is able to be still provided to those that needs it. And I think the revenue, 400 million, the RAF and Lesotho, I will give this one again to the acting CFO, and the disaster management also. Honorable Chairperson, yes, indeed, and we apologize. We do have people with clinical background on our delegation today, and perhaps next time we will make sure that they also under oath. We've got Dr. Grace London, who is appointed as the Chief Director for District Health Services, but she's an acting DDG for clinical services. We studied the questions, and that is why then we selected the two officials, because that was where the questions were going to be. But next time we will make sure that together with the rest of us, she's also under oath to be able to answer the clinical type of questions. Yes, Chairperson, we agree in terms of the finances. Like Chris said, there is definitely an improvement, that which the numbers can show, although there's still a long way to go. And among other improvements that we have made, Chairperson, Honorable Chairperson, you'll remember that this department used to be one of those that could not even afford third-party payments for the workers during the last financial year. And for the first time, we were able to pay the third-party payments of all the workers. Although some of the disbursements which we have done the run, I think on the 27th of March, they only reached SARS, for example, on the 1st of April. But that was the money that came out of the budget of the financial year, which has just ended, which was exactly contrary to what used to happen in the past. When you look at 30 days payments as well, there is just a slight little improvement. So with the strategy that the acting CFO spoke about, we really hope to see more improvements in terms of the finances of the department, working together with the clinical sector, because we always call Dr. Grace London our client, whom we are supporting and we are rendering the services for. So without really compromising service delivery on the ground, but making sure that there is value for our money. Yes, the issues of polynomy, maternity leave, it's one of those that we have planned that we want to.
I suggest you try wrap up. I want to answer all of them, but perhaps it would be wise to wrap up and give others. I suspect there are two hands on top of that. So as and when you wrap up, perhaps, yeah, you can wrap up.
Thank you very much, Chairperson. I think that will assist me because talking more might attract more questions. Let me leave it here. Thank you.
Thank you, Honourable Chairperson, honourable members. With regards to the question of the Lesotho government, so in March 2024, the Lesotho government owed us 235.7 million. In the whole financial year that's just ended, they paid us 235.6 million. So it's roughly about 150,000 that they still owe us from a year ago. So they've managed to clear all of that, they've paid all of that. In the new financial year, for new referrals and new services provided, they've increased, or we've issued invoicing to the value of 85.6 million. So that's the balance that is due now. So it's gone from 235 million down to 85 million. So they've really closed the gap. We're working well with them to try and get that account more current, but we are very appreciative of the strides that we've made. In terms of the revenue as a whole, the accrued revenue includes other key stakeholders would be the Department of Justice for services given to correctional services. That's a bit of a dual relationship. So we owe them for state attorney fees, state law advisors, which are billed through that, but they owe us for correctional service patient fees. So at a national level, the sector is just looking at how best to offset that. As soon as they pay us the money, we have to surrender it to the revenue fund. So we lose it as a department, but we're incurring costs to service the correctional service patients. So we actually want that back as a department because we're incurring costs on that. So we're just looking at the best way to how do we settle that? How do they settle from their side? And then we don't lose twice for it. The other key stakeholder in this is the University of the Free State. We're busy finalizing an agreement regarding the dual staff establishment, and out of that there is an element where the University of the Free State owes the department, because we pay the full salary bill of those specialists or heads of department, even though they provide an academic element and a research element. So that is a process that we are undergoing with the varsity at the moment. In terms of the Diplomonomy Disaster Center, the main delays around that was the framework contractor for mechanical and electrical work. The quote that they provided was too excessive. The department could not accept that. We tried to negotiate the price down. That was unsuccessful. So then we actually went out on a new procurement process because we knew that that price was not feasible. This obviously then led to the main contractor being delayed. We have learned from that process that in future we should allow the authority of the main contractor to do the subcontracting and not limit it to our own framework contracts. So I think we have learned from that, but it's the price we pay where currently that project is not completed and we need to look at other procurement mechanisms to complete that still. Yeah, I think just the element of the triple Ps are ending in October. But as HOD has alluded to, we've already started what they refer to as the TRA1 with National Treasury and the consultants to look at the feasibility assessment to go out for Universitas on a new triple P. Thank you.
Thank you very much. And I think another stakeholder relation that must be between you and Public Works. I've seen they run around a whole lot of entourage of people of EPWP. And what I've seen go orange, there is a whole lot of grass that as tall as I am, where I don't know how people survive. They go to work, come out, even management. Somehow certain things don't really make sense, that you are working in working conditions are not good and you are tasked with a responsibility to correct that and you are not doing anything. People are indifferent, especially in the health department. I don't know what's wrong, but perhaps that's my suggestion. I don't want to rant anymore. Yes. I'll give you just after the questions. Maybe they must wrap up after their questions, then Honorable Leach will come in. Thanks.
Thank you, Honorable Chair. I'll just comment on the issue of collaboration, which came up quite a number of times. between ourselves and the different departments. Indeed, we do collaborate with the different departments, amongst them the Department of Social Development. But perhaps what needs to be strengthened is the stringency of the collaboration that would ensure that the different stakeholders can be held accountable for the niche roles that they need to play in that collaboration. For example, if we take malnutrition, there's quite a lot that needs to happen prior to the Department of Health getting involved in trying to manage a malnourished child, which includes food security, which includes dealing with poverty issues. And indeed, Honorable Khwabane said we are bearing the burden of social challenges that obtain in our society. So perhaps what needs to be strengthened is how do you make sure that everybody plays the role that they should in order to make sure that we can prevent malnutrition, and if children happen to be malnourished, then health can manage those that have missed the interventions that were meant to prevent malnutrition in the first place. Thank you.
Honorable Leach.
Thank you, Chairperson, for allowing me now. My apologies. I wasn't initially going to comment, but yeah, in Afrikaans we say, dit maak my warm onder die kraag. I think it's time to be frank. The reason why you could pay third parties this year is because Lesotho paid over the money. And to say that you are very appreciative of Lesotho paying over the money is absolutely ridiculous. We offer them a service, they should pay us. If they don't pay us, we don't offer them the service. They should be invoiced monthly and their accounts should be kept up to date. If you look at the private sector, if I walk into a hospital now and I'm not able to put down the money to get the services, they show me the door and I go out. We've got South Africans lying on the floor in Palanomi. We've got patients dying. We've got people telling us that they aren't able to get medicine. Our own South Africans have to stand in queues for a whole day at a clinic to get a reference letter, a referral to go to emergency services. But we are appreciative of Lesotho paying us the money that they owe us for services we delivered. That's unacceptable. Thank you.
I think I must hand over to the MEC to say his closing remarks. I don't want to prolong this matter anymore, but MEC, your department, like I said earlier, is the baby of this portfolio committee. And perhaps as and when you speak to that, I think Honorable Khwabane reminded me of something. Maybe it's high time that perhaps you and I yourselves, as MEC and executive power in the department, tell us, okay, you would benefit more under administration. Section. There was a time, I think, multiple departments were put under administration here. Because my fear is we've got more Free Staters and more South Africans and Black Africans who are losing lives, maybe due to reasons advanced here, and I think people who are in the clinical floor can speak differently because of shortage of medical consumables, medicines, personnel, overworked personnel, because, you know, I'm not scientifically correct, but I suspect one person once a day who is a specialist does a work of the entire week in a day's session. So the following day when they come back, chances are they are over, they're already exhausted. So you might get a person who would get easily, they decide, let's leave this department. And we're at the juncture, when I arrived here, the public health service was the best. we're competing with some of the public institutions, private institutions. So right now, we know our people are slightly hectic, even us, ourselves. We don't want to use your services for fear of ending up in one of your mortuaries. Of course, I know latent services is not all right, even in one of your mortuaries. So I'm just saying, just speak to those and maybe consider, or would it not be advisable if you hand your head over, your beautiful head that is MEC, hand it over for administration. Thank you so very much. The floor is yours, MEC.
Honorable Chair, let me assure you that if we are convinced that that's the only route, we'll gladly follow it. Because our priority is that our people should get healthcare that is professional. And Honorable Leach, I think it could have been the choice of words, but apologies for that. I think it's true, Lesotho has to pay, but let me also indicate that our porous borders, they give us a serious challenge. You have patients that are officially referred to us by Lesotho government, which they take responsibility of. But you have these that are in here illegally, which Lesotho government refused to pay for. And those are issues between country-to-country relations that would have to be resolved. And those that are not officially referred, they guzzle more than those that are officially referred. So those are some of the things that we will look into. Honorable Chair, the impact of PEPFAR and USAID is quite huge for us. But like the HOD has indicated, in terms of the ARV availability, the minister has been able to secure funding, which will be able to, mitigate the impact of that. Yes, even when I was presenting the budget speech, which I'm not sure, maybe I'll have to come and repeat. I indicated that the change of curriculum in the nursing training has dealt as a very huge blow, because the products that we have now is not meeting what the needs are. But the Free State School of Nursing is moving into that space. We start next year training healthcare professionals, advanced nurses training. So we start there. Our first intake will happen in January. So we're trying to move into that space. Honorable Chair, like I always mention that maybe you should set aside a day as a committee for us to talk about health issues, because there's so much going on there. We didn't even scratch the surface today. And it will be helpful that our public representatives understand the challenges that we have and are able to even give us advices and guidance in relation to what is it that can be done, which is always welcome. I think the HOD explained the EMS story. Yes, Chair, I think it's good that you arrived late on Friday, so you're not going there and pour petrol on the fire at Pilon. I think it's good. It's lucky that Honorable Mbalula is not here, otherwise they'll go and trace you. Yes, no, there were issues at Pelonomi, Chair. They are receiving attention, and we finding ways to deal with it. Chair, it could also be helpful. You referred to your M&E report. It could be helpful if that we are favored with copies of that, so that we also know how others view us, because we come here and present on how we look at ourselves. And it's naturally, sometimes it may be subjective, but I think that would really be helpful. Honorable Chair, I'm trying to save time and not respond to everything. Just few last things. The issue of mental health, Chair, is our huge priority as well, especially coming to the fact that I think it's July month, that is our mental health month. We're going to be focusing on that and looking at to what exactly that needs to happen. But the issue of health, Chair, is something that we really need to be assisted on as the Department of Health, because we get to be involved at the tail end of the process. When the health has been compromised, that's when we come in. I think we need to be focusing, like you're saying, primary health care and the NHI approach in terms of dealing with issues immediately when they start or even before they start. And we'll come and talk to yourselves about our approach to primary health care. When I presented the budget speech, I spoke about our primary health care realignment. Our biggest challenge is that we have a lot of policies and we have staff that's very busy. At a certain point, it becomes difficult to balance whether you call an in-service or you allow your nurses to attend to clients. So that balance has created a huge challenge for us, whereby our policies, even at service delivery point, are not properly, implemented. Especially, let me talk about this thing of decanting our patients to other places. So once that has been fully, explained and internalized by our frontline staff, we believe that things will be a little bit different in relation to that. Honorable Chair, let me stop here before I also attract more questions. Thank you. We really appreciate the opportunity. All the inputs that have been raised, we will look into that. Thank you, Chair.
Thank you very much, MEC and the team. We hope to see a serious improvement in future. I think since you've attracted attention to this portfolio committee, feel free, MEC, anytime, call us. We don't want, otherwise people like us who are trained differently from a different school of thought, we end up, institutions kicking some doors, greeting people that were not even supposed to greet. So invite us anytime. I think that will be highly acknowledged by the team, because we've been expressing our more like displeasure about the congested program, your legislature. So if you invite us, it's also a gesture of goodwill. So we'll appreciate it, and we take note of that. I think we had already received a report from the MNE that they have started, or they are going to start, something like that, to engage with departments, which I think can assist, especially in the department. Thank you very much, MEC. Le lefapha la hao. Tswelang pele ho etsa botle bana beso. Thank you. So let's take 30 minutes, members. We'll be back accurate. received earlier on that was not even signed HOD, and that appeared as a response towards the questions that were raised that came out of our oversight visit, go Bergman. So that being said, I'll somewhere allow a presentation. Let's hope it's fast. I know that we held you a bit longer because we had to give concentration to the Department of Health, and we extend our heartfelt apologies. But this is work that needs to be done. Unfortunately, we can't skip and rush through it. It must be attended thoroughly. So that being said, let me allow a presentation. I hope that touches quickly on both responses and perhaps the second and third quarter. Yes. I don't know how fast can you cover that. Maybe when you get to that, focus on the non-achievements and deviations so that we are on par. Yes. Thank you very much.
Chair, your kind direction. Should I not focus on the responses to the questions that we got? Should I go to the presentations themselves?
My take is because of the members, I think it's unfair on their part to say you just take them through when they just received a document now. Understanding is because we had submitted questions earlier on, the response will come in time so that when they prepare for this session, there would be. So for that one, I'll ask members to then take this home, go through it. If there's a need, then we submit questions for written reply. Then you are left with a presentation for. And Akere, we are wary that this is a joint sitting. I'm co-chairing, by the way. Skala mona ndate khobane mona a le relaxed, and I think he must have taken the session, both financial and non-financial. So we're in both PROPEC and social cluster portfolio committee, joint portfolio committee. I hope that sheds a light, HOD. Thanks.
Thank you, Chair. With your kind direction, I would focus on second quarter first, and then deal with third quarter last. And acknowledge that the APP is common cause. Thank you very much, Chair. Chair, consideration of the second quarter non-financial report for 2024-25 financial year of the Department of Education. Understanding that most of these indicators then were actually ongoing. I will start first with the second quarter. I want to read to record the fact that we had a cumulative number of 71 indicators as at the second quarter, and annual indicators were 66 and 5 were quarterly indicators. Chair, I will simply go to those areas where we have underachieved. I would go to outcome indicator 101, number of special schools that use SASMs or any alternative electronic solution to provide data. The target was 938. We had missed the target as at the second quarter by 2, which was Fontaine and Utopia, schools that were closed, and all public schools were on SASMs. And the same goes for the number of public schools that can be contacted electronically. The same number because of those 2 schools, Fontaine and Utopia, still obtained here. And when you look, Chair, at outcome indicator 303, it is actually overachieved if you look at the quarter 2 against the annual target. Now, I've provided legend in our submissions. You'll see program 1, administration. We've got 4 achieved targets, 4 in progress, and 1 planned target. Chair, I'll just go to 1 planned target, which was the number of smart schools provided with additional ICT devices, which is outcome indicator 104. Here, this indicator was simply scheduled in the 4th quarter. That's why it has got a blue color. However, procurement process was already at the order stage since the PCP had been approved. And having said that, Chair, you will see that even though you've got slow movement on outcome indicator 105, it was because procurement for additional devices were still in progress, and then the same for outcome indicator 106. And then when you look at what outcome indicator 108, number of schools reached through advocacy campaigns on GBV, advocacy sessions were to continue in other remaining quarter. I'll go to program 2. You will see that we've got a total of 30 outcome indicators. If you look at the legend, we have actually achieved 18 as at quarter 2, 14 were still in progress. Chair, I think I can skip this program, as I believe that all the targets were achieved at the end of the fourth quarter. And then I can only speak to outcome indicator 226. Outcome indicator 226 was our problem, Chair, and I think the same goes for 227. This is where you would find that we need to upload resources that we allocate to schools. Now, the schools had a lot of challenges in terms of capacity, because for all the books, stationery, or rather let me say LTSM, as well as textbooks, they have to be uploaded on EMIS textbooks, and the LTSM has got to be uploaded on SASMs. We had a lot of structural challenges with colleagues here from school level who could not upload, but we have since tried to ensure that they've got scanners where they can upload this information moving forward. Another avenue that we are seriously considering is to centralize the procurement of LTSM and textbooks so that we can take responsibility for that, because schools don't get audited. We are audited for transfer payments that we make to schools. When you look at program 3, independent school subsidies, all the 3 targets were met as at quarter 2. And then when you look at program 4, Chair, public special schools, 4 of the 5 were achieved. 1 was in progress, as at the end of the financial year, they were all achieved. When you look at program 5, which is early childhood development, all 7 of them were approved, were achieved, so to speak. And then you look at program 6, which is infrastructure development. You will see most of the targets were in EMBA, 1 was in planning. This is reminiscent of the nature of infrastructure development. They've got their own lifespan, though we spend within the norm, but because infrastructure projects, they've got 4 stages of development and execution, and plus the challenges that we are confronted with on the ground, we find that we have those challenges. I will go to program 7, which is exam delivery. You'll see that exams, as at the time of the second quarter, were only going to be reported on in the fourth quarter, because the NSC takes place around October. It's taking stock of the fact that the second quarter starts somewhere in July or June, something like that, yeah. But if I was to give summary of our performance in the second quarter, as at the time of reporting, for all 76 output indicators, we were at 52% of all those that were achieved, and then in progress we had 28%, and those that were planned for quarter 4 were 20%. Chair, that brings to the end the presentation on quarter 2. Chair, I had initially gotten the brief without putting my colleagues in a bad light. I had planned for to go over the questions. So I had to throw my documents on the floor. Oh man, where's my document? Okay, yes. No, portfolio committee, but the third quarter document. Sorry, Chair. The third quarter. Okay. Oh, yeah, guy. No, sorry, Chair. And when we look at consideration of the third quarter non-financial report for 2024-25, financial year for our department. Chair, you will see once more, we've provided a legend that shows that we've got 71 output indicators. 5 were quarterly and 66 were provincial. Chair, I will go to the next slide that talks about quarterly output indicators, which are 5. You will see that, Chair, at the third quarter, we were very comparable to the targets that we had actually set for ourselves. Save for minor underperformance of 931 against planned 935, that which is for both outcome indicator 101 as well as outcome indicator 102. The reason there being that there were actually 4, if not 5 schools that we closed because they were found to be non-viable. When you go to program 1, administration, you'll find that you've got 9 targets, outcome indicators. 4 were completed, 4 were in progress, 1 was in the planning stage. I'll only focus on outcome indicator 104, number of smart schools provided with additional ICT devices, out of consistency, Chair, with the other one. At this stage now, there was more movement. You'll see that a total of 2,100 devices were currently delivered and were available. And our IT technicians were busy with the device setup before they could be distributed to smart schools, including installing things like programs that those schools will be using, and also ensuring that they stop access on certain apps for learners. And then the next one will be outcome indicator 105, number of teachers provided with ICT devices. The annual target was 400, but as at the third quarter, we had achieved 300. So the balance was to be delivered in the fourth quarter. And 106, number of office-based educators provided with ICT. Against 50, we were at 36, which was quite a good achievement, and we were to finalize them in the fourth quarter. When you go to public ordinary schools, you'll see that we've got a total of 30 targets. 22 were achieved, 6 were in progress, 2 were not achieved. Number of schools provided with multimedia resources, I think you can start seeing some overachievements, achieving within the norm, sometimes above the norm, and reasons for deviation are provided, especially when you look at outcome indicator 204, it looks grossly overachieved, but we got more resources from a stakeholder called Jollyphonics, which brought more resources. I think I want to skip this, Chair, because I wanted to focus mainly on underachieved. But when you go to outcome indicator 222, you will see that we are starting to have a better uptake in grade 10 of learners in physical sciences, learners in technology specialization, learners in agricultural subjects, and then EGD, engineering, graphic and design. We are starting to see an uptake in the arts and mathematics. The reason for this is advocacy that we made, where we found that many schools, when learners perform badly in grade 9, they would then encourage learners to drop gateway subjects like mathematics. So our throughput rate, we calculated from grade 10 moving forward. So we stopped that hemorrhaging of learners. What we are now doing is that the group that we have in grade 10 must just ensure that this group finishes and to write at least grade 12. You will see, Chairperson, the same issues where we talk about percentages of learners with access to required maths textbooks in grade 6, 9, and 12. It's the same reason that I spoke about using, I would say, a central repository of data, which is our SASMs, and non-uploading by the respective schools. When you go to program 3, independent school subsidies, you will see out of the 3 targets, 2 were achieved, 1 was in progress. And I think number of learners subsidized at registered independent schools, it was, we targeted 14,900, we had 14,461. Chair, for lack of a better word, I think independent schools have left much to be desired in this province, particularly in Motheo. We have registered independent schools that would meet the minimum standards, but subsequent to that, they just disintegrate to a point where we had to intervene at some point to take those learners from those independent schools and try to distribute them around schools that can still have some space. A case being one school like Adlodem. Some of them, I don't understand how they are able to run this business, because it's business. How they are able to run it effectively if you only have got 10 grade 12s. And they are doing different streams. It's not like they are doing one stream. It means for those 10 learners, you may have to provide, just for the 10 learners, in excess of 15 teachers. It can only be sustainable if each learner pays 50,000 per month. Otherwise, I don't understand how they are able to attract teachers. Teachers leave because they are unable to pay their salaries. So we are finding that problem, but we have since centralized the function. We refuse to register them if we find that they don't meet minimum standards. Now we are currently deregistering Educollege in Velcom. They have not met the minimum standards. They are failing children. There are no support to those learners. Learners are left to their, on their own. And they have used retired old people to teach these learners who cannot cope with the demands of modern pedagogy delivery. Program 4, Public Special School Education. Chair, you'll remind me if I'm moving fast. I'm trying to save the committee some time, but still do justice to the presentation. And on Program 4, Public Special Schools, you'll see we had 5 indicators, Chair. We achieved 4 and 1 is in progress. I think the one that is in progress is number of schools of skills implementing the technical occupational stream. We had achieved 8 instead of 9, because Motheo had identified a school in Botshabelo, and the learner admission and provisioning of equipment was underway at the time. Now, early childhood development here, Chair, because this is it evokes our conscience, is our toddlers. We ensure that we act according to the norm. So there's really nothing to report here. We actually implement according to the expectations. Infrastructure development, you would see we had 7 targets. As at the second quarter, 3 were achieved, 4 were still in progress. I will pick one, Chair. Number of public schools provided with electricity infrastructure. I know that here whenever we used to procure for electricity, we used to use the CIDB database to get people who are qualified. But that has had its own challenges. So we went into our own internal systems and were able to get electricians. But in the interim, we procured generators to ensure that there is no lull, especially at schools that will be doing ICT or anything that requires that you power the things like laboratories and everything else. Other than that, we're doing well. The other program that we are very aggressive about is the number of security fences that we are constructing. We are now looking back at issues of school safety. We believe that the first line of defense is to have a credible access control, ensuring that we start scaling on fencing. I could imagine that at some point we had 55 projects that focusing on fencing. We must also admit, when you look at 604, number of schools provided with new or additional boarding facilities, we really depend on Public Works to action or activate this, as the threshold for implementation of this infrastructure is higher than what is approved by EXCO for us. So there is a hostel that has been there since time immemorial that has been giving us a problem. It's called Le Boneng. It is actually in Velcom. This hostel is almost complete, but there is a back and forth regarding the unapproved variation orders between Public Works and the service provider. It has actually affected us negatively. The only positive to take is that in the corresponding period, we were able to execute the one at Orange Krag, which was critical for Harib children, because Harib has got its own dynamics. Harib needs to be protected at all times, because not even everyone wants to work in Harib. So to an extent that we can assist the children, keep them captive, give them quality education, those are the people who come and turn the tide of the current material conditions in that district. Program 7, examination and education related services. Now you start seeing us spending. You start targets kicking in. The targets, because now it would encapsulate also October, if my memory serves me well. CFO? Yes, thank you. And then now, the only target which was in the red, it was percentage of grade 12 learners achieving 60% and above in physical science. Fewer learners achieved. Physical science was a killer subject in 2024 for the whole country. We have always been number 2 in the country in terms of passing learners in physical science. We're still number 1. So it had a downward trend for the whole country. I think it's one of the subjects where we really needed to go back to the drawing board to see how we can upscale it and ensure that learners pass it at the expected rates. Other than that, you will see the targets that we had. For general pass rate, we had targeted 85. We got 91%. And you'll see that for bachelor passes, we targeted 40. We got 48.2. You will see that the percentage of grade 12 learners achieving 67% and above in mathematics, we had targeted 13. We got 16.2. And the number of secondary schools with a national senior certificate pass rate of 60% and above. Out of the 320 schools that were targeted, we actually achieved 352. So, Chair, other things I would presume that they are common costs. Safe to say, much of our schools are offering academic stream, which is a problem for a country, a third world country, that needs to turn around its situation. We need to push learners to technical, vocational, and occupational stream. So in doing that, we started implementing technical maths and technical science. Technical maths and technical science were very difficult in the beginning. Even the norm had to be determined over 3 years to look at the highest level at which learners could perform, plus the addition of the practical assessment task. Now, when you look at where we are now with the technical maths, we are targeted 85%. We achieved 97.1% pass rate. For general technical subjects, we had targeted 95% performance. We achieved 98.7%. It's something really to work from and ensuring that we actually do more advocacy, especially on parents, to make them see that learners need to move towards the engineering stream so that those skills are critical in changing the narrative, but also skills that will also make learners at least to be employable in an event that they don't find themselves at university or any institution of higher learning. With that said, Chair, that was the end of my presentation on the 2 quarters.
Thank you very much, Chodi. Members, questions? Honorable Leach, any other hand? Honorable Pretorius, Honorable Foko, and Chief Whip, you'll be the last one.
Thank you, Chairperson, and thank you, HOD, for the presentation. Mine is just, if you can just explain to us the process of determining which infrastructure projects will be embarked on, and then that relationship between the Department of Education, the EXCO, and Department of Public Works. Because I understand, and I have also had the discussion with the MEC, where it would seem as if we are very positive and then we take on a lot of projects, but we do not necessarily have the capacity or the funding to finish them. So if you can maybe just explain that process for us, and what would be your possible solution to that? Thank you.
Thank you very much, Chair, and thank you for the presentation. by the department. I just have a question on the output indicator regarding the number of schools participating in sport activities, as I also sit on the Portfolio Committee for Sports, Arts and Culture. The target was 500, achieved only 220. Unfortunately, when we drive around as members of the provincial legislature across the province, we do find that at many of the schools, as well as the municipalities, unfortunately, there is dilapidated sporting infrastructure facilities. I'm thinking, for example, our children are in the streets in the afternoons, not participating in sports, arts, culture, even learning to swim, especially in our rural areas. As children do not have access to municipal public swimming pools where we can be actually teaching kids from a young age to swim and on water safety and so forth. So there's quite a few silos that have to be crossed here. But just in terms of the actual target by the department, only achieving 220, what is the department going to be doing about that, to actually, after school, also getting our children into sports, into culture, into arts, as well as having a discussion at some stage with Kochta, Sports, Arts and Culture, about what can we do to get, especially in our rural communities, the netball fields, the soccer fields, rugby, you can name them, traditional sports as well, to get children at least 1 or 2 hours in the afternoons. It also comes again when we speak about primary health care, getting kids active, exposing them to something outside of only academics as a whole person. Thank you, Chair.
Thank you very much, Chair and the HOD and your team. Mine, Chair, it will be a very simple one, Chair, because the other one has been asked by Honorable Leach here. Chair, maybe this one, it's falling under the Department of Public Works. There is a school there called Vaihook Combined School, somewhere in Lejwe Liputso. Chair, that school there, I don't know, is vandalized or is dilapidated. I don't know how can I put it. No ceiling, Chair, and it's cold now. No doors, no toilets, Chair, in that school, and no teachers. And the class, they combine the classes. I don't know whether is it according to the standard of the Department of Education, because when you combine a grade 5 and grade 6, that is not acceptable, Chair. So if the department, they can look on that one, we must not look on the passing rate only. We must also look after to our children who are supposed to pass at the end of the day, Chair. Thank you very much, Chair.
Thank you, members. I'll allow the department to answer, but, Chief Whip,
Chairperson, I accept the focus of the department in shifting kids to do mathematics and science. But I know that this is an argument I used to have with the late MEC Tate. Science and mathematics are critical, but history is also important. So in many countries that deal with or focus on ensuring that kids do mathematics and science, history becomes a compulsory subject up until matric, so that you build a nation that knows where it comes from, so that it can understand where it's going. I would request that as they do that, they must ensure that that history also becomes compulsory. The second issue is that, like Honorable Bernard has said, the same way as with the previous department which was here, we have these social ills affecting young people drugs. Interdepartmental approach to deal with social ills. And I think one example is what the Honorable referred to, ensuring that kids play sports. And then lastly, Chairperson, we have been performing well at metric level. But one of the things that we have not done, I think it also goes the same way to cooperative governance approach to the outcome, the exit strategy of our students. They pass matric, nothing happens afterwards. So I think it's one of the things, but I think that one needs the participation also of other departments working together with the Department of Education. Thanks, Chair.
And, thank you very much, Chief Whip. We will allow you, the HOD and the team, to answer. But then just to piggyback on what the Chief Whip is saying, what then is it useful to have learners matriculating going to go home? Because when you look at spaces for institutions of higher learning, it's even worse. We can accommodate all of them in the Free State, but be that as it may, those that are having no space to be accommodated in the institutions of higher learning in any way can be absorbed in a job market because they are ill prepared for challenges in the economy. So that being said, I think perhaps that much needed collaboration here could save us. HOD issue ya textbooks and books. I'm trying to wrap it around my head because beginning of the year I went to an area called Hop House, a small farming community, I think south of Tuesprate. I got there to realize that one, textbooks were not enough. They were not adequate for learners, let alone stationery. In a no-fee paying school, parents still were forced to buy books. Something is not odd. Something is a bit odd about that school. There's a project there that is incomplete and nobody can really tell you what's happening. It's because teachers behaved like thugs. When we got there, we were met with something that you called a human shield, where teachers believed that because it's their school, nobody can enter. And they are, I think, about 100 meters from a police station. When someone that you don't know, you claim not to know, who somehow visits your school, you don't behave in that manner in a workplace. So violence in a workplace is not acceptable. So if they treat us like that, we wonder what do they do to kids? Which brings me to the next item about sexual violence and actually physical violence from teachers. There's another one here in Tsoseletso that nobody is saying anything about. I think we need to be taken into confidence about that item or what has happened. And there are allegations about sexual assault in Grey. We really need to be taken into confidence about this. This is an unacceptable behavior of teachers that somehow are in your system, trained, went through the institutions of higher learning, but somehow still lack moral grounding and some form of professionalism that one wonders, but these people, why are they not in that register where they can work with children? Because somehow they are very dangerous. They appear dangerous. I mean, if you see anyone who's my age, you should consider them either a parent or anyone. So your conduct should be that of. And I was worried, HOD, when I saw Raadsaal in social media. And I thought to myself, could this not be happening to majority of these schools that have hostels? Yesterday, what I saw there was appalling because it seems like learners were protesting there, complaining about food and treatment. And mainly, I think we're missing something about this food or nutritional program across the Free State. Something needs to be done before we can lay our hands on that program. I suspect something is not right about that program because one time I went to Sasolburg, I can't really remember the school, where I got this canned fish, tin fish, where you could tell, this one here, it's now just gravy and pap. I thought to myself, maybe it's a well-balanced diet, but looking at it, to me, it was not appetizing, but I let things be at that time, hoping there's going to be an improvement. So let's quickly, and there's this program, I don't know on which, does it fall, on what program does it fall? But you have this program of taking children with special learning needs and placing them into what I would call a normal school. For example, I went and paid a visit to a school is it Heidedal High School, but it's some high school in Heidedal. I suspect it's not Heide, it must be Heidedal High School, where I found a child who was blind, who lost about a month at the time, who needed braille, but there was no equipment. All she had there as a form of support was this walking stick. Next to her was a volunteer of a person who just assisting the family, who's not even paid. So when you take a child out of a normal school like, at least for her, it's normal because Bartimia is supposed to be, with a reason that there is no African-speaking teachers, and you take her to at least African-speaking teachers with no infrastructure, at least relevant to her needs, then what is the use of that program when you take kids with special learning disabilities into normal schools? Because it seems like it was a torture. That child is being prepared for nothing, actually. She goes there to spend time to do nothing. She's not learning like any other child, and I think that's a mess. It's a mess that needs to be corrected, as in yesterday. By the time I'm told that braille machine had arrived, I think that child has lost almost, I don't know if there's even a catch-up. I don't know if even teachers are prepared. It's worse in that school, at least for her. And lastly, when I'm about to step off it, the issue of DBSA and infrastructure. I just want to be taken into confidence. Something is wrong with DBSA. And DBSA, because some entity, government is not treated like any other contractor that we outsource work to. And DBSA is giving us raw deal. I want to check how many schools that they have missed completion dates and how many schools have they not completed so far that they can't really complete. Because in my mind, I'm having a school in Bothaville. I can't really remember the name of the school now, where every time you come there, you'll be told of DBSA. And for how long this ping pong will continue, this back and forth, for how long will it continue? And what best can be done between yourselves and DBSA such that we get infrastructure when we want or as and when we expect it? I think that would be all from my side. I don't want to take much of your time. I think from there then, we'll hear from members if they have follow-up questions and then release you. Thank you.
Thank you very much, Chairperson. The process regarding projects to be implemented, and that informs which projects are implemented by the department and which projects are implemented by Public Works. All things equal, Public Works is the custodian of all state assets, all things equal. But the infrastructure arrangement in all education departments is that for projects that are related to education, we have to develop our own, for lack of a better word, PMU. That is why you've got Mr. Moeti as the Chief Director of Physical Resource Planning or Infrastructure, for lack of a better word. Initially, the arrangements were such that all projects below 10 million can be done by departments, and everything going up can be done by Public Works. With a fluctuation of time, Public Works got, hey, words have a primary and secondary meaning. I just need to be careful of what I'm going to say now. I think they've got capacity constraints, and all departments, health, especially us and health, started having a lot of strain. Now, there were issues where you will find that we'll end up doing projects around 15 million, but give and take, they are the legal custodians, but we have performed better than them. The department has received, I think, over 400 million of incentive allocation for the past 6 years. That money is realized through projects that we do internally, including the current performance of our department, where money was taken from Limpopo, 50 million, and given to the province. It's because of the performance of in-house projects that the Moeti them are doing, because we have capacitated their unit. They've got all breadth of professionals. As we speak now, Honorable Member, we are making a submission to EXCO, where we want EXCO to allow us to increase the threshold, at least handle projects up to CIDB level 7. That is supposed to permeate at the current technical cluster that is oncoming. I just needed to deal with that so that we are able to unlock other issues. I'm unable to defend issues where a school is 7 years under construction. I've run short of explanations. We have such issues. You are asking us about Leboning. Leboning is under construction for more than 4 years. So those are the issues. Sporting facilities, yes, it is what it is. I don't know. My gut feeling tells me probably that the evidence mechanism that we collate is flawed. We've got more than 220 schools that are participating in various sporting facilities. Probably the issue of seasons. Remember, there is a existing MOU between the Department of Basic Education and Department of Sport and Recreation at national level. They've got community sport at sport, but they also have got school sport at sport. So we work together with them. Instead of having sport playing for the whole year, now they are playing in terms of seasons. A child will only be active for 3 months in athletics. From there, the child does nothing. And then whether it's soccer or what, that thing has killed sport. I want to be honest. I'm a product of that Wednesday school program where you will meet. It will be a pilgrimage of schools like Suhunelo and Lereko, where it will, even their players will be playing for either Bloemfontein Celtics. Whilst they're still at high school, you don't find that now, because players are being now pigeonholed into playing within the age groups. That is one part. At the time of reporting, you can only report X number of schools. We started a program which is called Magnificent Wednesdays. Maybe at some time, the committee can even say, come and present the school sport environment so that we have a feel and what has happened of it. You'll see a lot of players that some of them are finding themselves at professional teams as we speak now. So yes, I agree. The problem is facilities. We are starting what we call township revitalization scheme run by Mr. Moeti. We are now revitalizing all those schools of a particular age span, ensure that they've got gates, you can get into a school, there is paving. A school brings back the dignity of people who work there. And also try to have 1 or 2 facilities inside. Probably at some stages, we can give you a program. We also have got very supportive Model C schools like Saints and Grey College. There are competitions that they also do, pulling learners from the township. It's such a beautiful thing because soccer is my best love. I'm always there. So I can't get high on my own supply, giving my own testimony. So I'm just supposed to report as an HOD. That I would do. I think you are right. When you go to Germany, they've got what they call open all-day program. A child, much of social ills, they happen between 2 o'clock and 5 o'clock when the parents are not there. Now, we should expand the school time to ensure that learners are kept longer at the school environment because there they are at their safest before they then get released to the custody of their parents. It's a discussion for another day because there are also unions involved in all that issue. Then the school is Vierhoek. Yes, it's Vierhoek. I will go to the school. 2 things that we are raising there that are wrong, multi-grade teaching. You're not supposed in the same class combine learners of 2 different grades. That's why we are closing schools and then taking learners to hostels. I will also find reasons why principals would do that. And if that matter is a renovation matter, at this top of my head, I could not really respond to it because I did not, have it on my plan, but Mr. Moeti is here. Will ensure that the next time we come to this committee, we'll report on it, Honorable Member. If I could, I would never speak about grade 12 results. Because I believe that even the current state of finances in the department is obviated by our achievement in grade 12. Nobody understands why we will come here and say we are technically an indigent department. For past 8 consecutive years, we've had an audit outcome of being an ongoing concern. We've got liquidity challenges. We've been underfunded. Our department is overspending its budget by over 1.6 billion. Now, those hard-hitting and factual issues that's supposed to be addressed, they get lost in translation because of our achievement in grade 12. It looks like all is well that is well. But you will see that we are really fracking underneath. So I don't like talking about grade 12 results. They don't really represent what we should be anyway. We should be putting our best money on ECD until grade 7. Then the system would have been created that produces results, not human beings. If we look also at the disproportionate allocation of resources to pass the class of 2025, it is really sad because we should actually be using that money and fund grades from the ground up and ensure that these learners are grounded with pedagogical as well as professional tendencies. They'll pass on their own. They don't need us to defend them like we're actually doing. The next issue is maths and science. Yes, Honorable Khwaban. We've got what we call standardized and non-standardized targets, and these are sector targets. They are putting more emphasis on STEM subjects. Yes, we agree that all subjects are important. We're simply saying, as I was talking, as if I'm talking on behalf of DBE, is to create this breadth of skills that are relevant for the 21st century. Because what was relevant in our time is no longer relevant now. The kind of skills, the kind of jobs that are supposed to be pushed here are different. Secondly, our mandate of job creation should not be leveraged at the expense of other humanities like history, as it should be. We are simply saying probably one of the mistakes we made was to close the Ambach schools because average South Africans are unskilled. So we need to push learners towards technical, vocational, and occupational streams. And we mentioned drugs, but there's another pandemic, which is learner pregnancy. It's a pandemic of our time. We're losing girls. And once you start losing girls in a developed ecosystem, you've got a problem with demographic dividend. You'll have that challenge because ladies, I'm not casting an aspersion on men. Ladies, by their affinity, they are able to raise a population. They are able to communicate values, and they are able to replicate the economy in many ways than one. So I may be unpopular here amongst my, but this is a crushing reality. that's a crushing reality. We are also concerned about the exit strategy that we spoke about. Higher education must come on board. If I were to be selfish, I would say it's not my business. My business is to pass learners at basic education level. The reality of the matter is that there are learners who do pass. Before, it used to be learners who will pass but not pass well. But now even learners who are passing well, they don't get admitted to any institution of higher learning. We should be worried about that. And I'm glad the committee has highlighted that issue. That's why we start talking about super bachelors. A bachelor passing, learners passing at level 7, a minimum level 5 moving up, because it's a competition for spaces, because now education is free. So that's why now the committee should help us advocate for the 3-stream model. When you look at our schools where we do welding and we'll do plumbing, girls are the best. Girls are the best, and it shows you the possibilities moving forward. We are the only country, probably, Honorable Chair, as I leave this issue, that thinks that we can grow economy with academics. Textbooks, yes, you spoke about your experience at Hope House. Chair, it's for this reason. At some point, procurement of textbooks and LTSM was centralized. Then out of further negotiations, there was a view that certain schools should be given their C function, which is the function to buy for themselves. We have come to regret that decision. Because when the buying obligation is on that other side, now you are left to the whims of the schools, having to upload. So we've been fighting the schools to a point where we took a decision that we now centralize the function so that we are in control, and I'm able to validate my answers to you, Chair. A textbook, is supposed to have a 5-year cycle. It's either the book has not been bought or the book has not been retrieved. We've got a poor retrieval rate that we are trying to enforce. It is giving the whole sector a problem. But yes, you are right, Honorable Chair, that we need to act differently. And I think the experience of the committee, I think, Chair, you once called me, and I insisted that we have access to a school because you are doing your work. I think we probably need to take out a circular to say, no, you must profile people, get their credentials, and allow people in the school environment. Unfortunately, teachers cannot arrogate to themselves the soul and conscience of a school, because a school is a microcosm of society. You want to check whether the school epitomizes the obligations as well as the purpose of the society around the school, with, of course, minimal control, because we can't create an open check that everyone gets into the school. It's always got security issues, plus there are norms and standards. But in your case, it was different, Chair, and we acted. We regret the behavior of these teachers moving forward. Yes, sexual and physical assault. Unfortunately, Chair, we have teachers who are still doing that. And whenever there is a case of sexual assault, we use the ELRC. We remove the case from the province. It goes to National Education Labor Relations Council. They handle those matters. And once they are found guilty, we then enlist them on the register. You asked a lot, Chair. You asked a lot. You referenced issues like what happens in Grey College, what happens in Tusele. So I can assure you, Chair, we work hard to discipline these teachers. And whenever there is sexual impropriety, you are found guilty, you get dismissed, including any teacher who is meeting physical violence, including also administration of corporal punishment. On the canned fish that you saw, our meals are gazetted. Schools cut corners. We will actually keep on, we're now doing unannounced visits ourselves as senior management at the time that they want to come and feed the children. Then we've got the meals are gazetted. We ask them, but there's no protein here. There's no vegetable, there's not this, there's not that. They do that, Chair. It's unfortunate, but we're working hard on it. Whole school evaluation, that's where you find disabled learners in normal schools. Chair, the vision of the department at national and the sector is that uprooting these children from their normal society habitation, where they've got, they come from a family to the school, also has got untold repercussions. Because uprooting a child from Botterville and take the child to Bartimea, the child is now denied the direct contact with affection from the family. We understand that's a double-edged sword. We try to support them where they are. Because today, wherever the children are, we have got breadth of skills like psychologists, social workers. It is tough, Chair, I must say. If wishes were horses, we would want to have a special school per second. That is why we are really concerned about the special school, the only special school that we are trying to build in Harib. It has been under construction or handed over for over 6 years. And Harib has got a serious problem of alcohol fetal syndrome, including teenage pregnancy. So those are the issues that we are dealing with. It's a tough balancing act, Chair. We can only choose so much, but we'll do our best to ensure that we acquit ourselves at every given point in time and improve the quality of our services within the budget realities that we have as the department, to support them with devices, to support them with assistive learning devices where we can.
No, thank you very much. I'm going to deny members a follow-up question. And I want anyone who has any form of a question to write it to the department. I think we need to come very hard, honorable members. Maybe me denying you this opportunity will force your department to, because all the HOD is saying is what they are doing there, but generally, we want consequence management. If this does not happen, then what has happened here? And I think Chief Whip must push very hard, because we can't have a child somewhere who is blind and is put somewhere and is not assisted. And it's the decision of the department, and then we're told we're doing the best we can. It must happen. And that child must receive same rights like any other child to learn. So this portfolio committee must come hard on you, HOD. And it must happen that that child, we do it in the best Korinje, there must not be buddies here, because we know, hey, he's a good person, he gives us the 100. We must deal with it such that it must never happen to any child, especially who comes from a disadvantaged, not for any child whatsoever, especially disadvantaged families, because they've got nowhere to go. Fellow members and the department, thank you very much. Continue doing work. Please don't redirect your effort and pick up the other because of financial constraints. We still want, now we want 100%, but it must be a meaningful 100% which has got quality and everything that comes with it. A thorough understanding that responds to the needs of the economy out there. And that's what I'm worried about. And lastly, HOD. Your managers, your circuit managers and yourself, and this is what I said to the Department of Health, you are starting to become indifferent. You can't get a message and just blue tick us. We'll run after you badly, and it must not happen, because once we do it out of the love of the constituency, which I believe is the same love you possess. So you can't get a message and just enjoy it must not happen. It must not happen, and we take exception of that. So members and yourselves, HOD, please continue doing work well, improve. We need improvement. There must always be 100%. We know that there is a consistency sort of under these financial constraints in the Department of Education. But we cannot not improve. There's always that room. So we must exploit that room such that we reach our logical goal. So I don't know if HOD wanted to say something. Is it on behalf of the MEC? Because this is a space where, I wonder this is how we get contested as politicians. This is a space where I give MEC to wrap up. However, I can give you just 2 minutes, HOD.
No, Chair, I just wanted the committee to take stock of the fact that we had a financial presentation to make, but because it's with the committee, if it pleases the committee, we could take it as read into record and considered, so that the committee does not come back and say the financial part was not considered. Chair, I'm using this ability because I was once a legal advisor to the legislature, where there's a financial report that needs to be presented, which is that second and third quarter report. If it pleases the committee and it reaches your favorable indulgence, it could be that you could say it has been duly considered.
I want to solicit the advice, Chief Whip, as the chairperson.
I would second that, unless if there are critical issues that the HOD thought they could be raised. If we can just get copies, yes.
Honorable Leach?
Chairperson, yes, if we can just maybe get a printed copy of that financial statement. Yeah, the presentation, the ones that we have is for non-financial, if I'm not mistaken. And then, yeah, it would seem as if, is it this one, the third quarter, okay, but this is also a non-financial report, also non-financial. So, okay, we're getting it. Then we can just say that it was tabled before the committee and we take note of it. Thank you.
So that's highly acknowledged, and you are invited, senior managers led by the HOD, to we'll be having a 5 minutes lunch. I know these members can eat quite fast, but we should be back, I think, at 22. Yeah, 22. Thank you very much. lack of our joint portfolio committee sitting and and welcome to the department led by the MEC. You are most welcome, MEC. A special type of apology that would go to all of you. We recognize that we've stolen much of your time, and we promise that it was necessary. And perhaps we need to reschedule these things a bit differently next time, especially when they are joint committees. However, there's work that was necessary to be done, so we will continue with that work. So that being said, perhaps I must give MEC RFA opening address and then quickly and then wrap this thing up. Maybe I must start there. I'll guide the committee on how we'll proceed on this session. Thank you. MEC.
Thank you very much, Honorable Chair and honorable members and officials present today. The apology is accepted, Honorable Chairperson, because we do understand that time management is part of good performance. I'm just going to request that after members or officials has taken an oath, because the questions are related to different programs of the department, that those that are given responsibilities to lead those programs will then respond to questions so that we don't waste more time, rather than asking them to do additions. So if you permit, I would just say thank you very much. I'm not going to say much, so that we are able to deal with the questions that are asked to the department. Maybe I will do my remarks as I close. Thank you.
Thank you very much for your understanding, MEC and the team. I think we should handle this session in this fashion. You had at least been asked to prepare a financial, an annual report. So let's waiver that for now. It still be submitted and be taken note of. And then you would also been asked to prepare for the, I'm just trying to get my papers correct here. There's too many papers. I think it's second quarter and third quarter. Both financials and non-financials. Yes, second quarter and third quarter. So the second quarter will be financial report, the third and fourth will be. So I think we need to do it in this fashion because researchers have already gone through your quarterly reports and then they've prepared questions that would guide members based on that. So perhaps what you do would then be, I accept that, well, I've been given guidance that both coordinators have submitted their reports from both ProPac and the social cluster. So perhaps whoever is going to present might focus on just that questionnaire and answer the questions, and that perhaps might lead us to a quick conclusion. We hope that's necessary guidance, perhaps that will guide you properly. So before that, then I'll allow Mayor Ramotiwa to do what she does best. Before you present to us, you know that you should be under oath. Thank you.
Thank you, Chair. I will then start with you, ma'am. HOD.
Thank you, ma'am.
Good morning, good afternoon. Please stand for me. Will you be taking an oath or an affirmation?
I'll be taking an oath, ma'am.
And do you consider this oath binding on your conscience?
I do.
Please state your full names for the record.
My names are Nelly Siwe Pel Ntombela.
Do you swear what you're about to tell the committee is the truth and nothing but the truth? If so, please raise your right hand and say, "So help me God."
So help me God.
Thank you, ma'am. Would you please assist me with the officials that will be assisting you today?
Thank you, ma'am. The CFO will take an oath as well as the program managers, Menon Dabula, Membuisa, and Metereko. Thank you.
Thank you. CFO, good afternoon.
Good afternoon, ma'am.
Will you be taking an oath or an affirmation?
An oath will do.
And do you consider this oath binding on your conscience?
I do.
Please state your full names for the record.
Musiwa Emmanuel Theophilus Rampai.
Do you swear what you're about to tell the committee is the truth and nothing but the truth? If so, please raise your right hand and say, "So help me God."
So help me God.
Thank you, Ntate Rampai. Afternoon, ma'am.
Afternoon, ma'am.
Will you be taking an oath or an affirmation?
An oath, ma'am.
And do you consider this oath binding on your conscience?
Yes.
Please state your full names for the record.
Fezeka Fidelia Nondabula.
Do you swear what you're about to tell the committee is the truth and nothing but the truth? If so, please raise your right hand and say, "So help me God."
So help me God.
Thank you, ma'am. Afternoon, ma'am.
Good afternoon.
Will you be taking an oath or an affirmation?
I'll take an oath.
And do you consider this oath binding on your conscience?
Yes, I do.
Please state your full names for the record.
Makotso Elizabeth Mbuisa.
Do you swear what you're about to tell the committee is the truth and nothing but the truth? If so, please raise your right hand and say, "So help me God."
So help me God.
Thank you, ma'am. Good afternoon, ma'am.
Good afternoon, ma'am.
Will you be taking an oath or an affirmation?
I'll be taking an oath.
And do you consider this oath binding on your conscience?
I do.
Please state your full names for the record.
Maele Isabel Winky Tireko.
Do you swear what you're about to tell the committee is the truth and nothing but the truth? If so, please raise your right hand and say, "So help me God."
So help me God.
Thank you so much, ma'am. Chairperson, thank you.
Thank you very much, Mayor Ramotiba. And I think we should just follow that guidance so that and I fully understand MEC. Perhaps this is the space where I dish out compliments that we conducted an oversight around November. I think it was first week of November, around the 6th, the 10th, and we visited one of your regional SASSA offices here in Mangaung, and we received properly there. And not only that, even after we asked questions, they showed the decorum that we are expecting from the department, and I think we must acknowledge that. What is good should be good, but however, we'll call out what is bad. So as such, I thought I must end here so that these compliments and all of that. So thank you very much. Let's start with the presentation.
Thank you very much, Chairperson, for giving the department the opportunity to appear before the committee for the second and third quarterly reports for 2024, 2025, both financial and non-financial. Chairperson, may I request that we start with program 2 and 3, which will be handled by Membuisa. Thereafter, Menon Dabula will answer questions relating to program 4. Then lastly, the Chief Director, Medireko, will then deal with questions relating to program 5. The CFO will answer questions relating to the transfer of assets as well as transfer payments. And I will then wrap up and just answer the questions that were asked specifically on the overall performance of the department. Thank you.
I hope that it's in line with the questions. And if it's not in line with the questions, at least must be in line with the deviations and non-performance. So whatever you do, at least vacillate between those two poles. Thank you.
Thank you, Chairperson. I will start with the questions relating to Program 2, Social Welfare Services. There was quite a number of questions under this program, and the responses are indeed in line with the underperformance that has been highlighted. The first one was with regards to corrective measures that are being implemented to address the underperformance under persons with disabilities accessing service, protective workshops. The response that we're having here is that, Chairperson, we had suspended one of the protective workshops in Friede as a result of mismanagement of funds. And we undertook some research there, and we went to that organization, and we could really see that there was indeed mismanagement of funds because the committee was not there. Only 3 members remained in the organization. As a result, then the district recommended that we fund the organization. So the interventions, besides or before we started even with the suspension, we tried to do some interventions which included training on governance, financial management, but still, despite that, the organization did not perform. And then we will then say, as a department, we will continuously provide support to the organization to ensure that they are compliant. There was a follow-up question, Chairperson, which then said, how is the department ensuring sustainability of services given the challenges that have been mentioned? We then responded to say the department, as a department, we ensure that we're funding services that are compliant. However, to ensure sustainability of services, the district is strengthening capacity of one of the organizations that are in Friede to ensure that beneficiaries from the Tertiary Research Center do receive the service, just so that the service is sustainable. Under Program 3, Children and Families, the first question was asked, what strategies are being employed to increase the number of children placed in foster care, given the legislative amendments? Chairperson, our response here is basically that we just wanted to bring it to the attention of the committee that as a department, the desired performance with regards to children in foster care, it's not to increase the number of children in foster care, but actually to ensure that children remain within their families. Hence, with the reform of the Children's Act, there was an introduction of the child support top-up grant. The second question there with regards to families was that how is the department addressing the decline in family members participating in family preservation services? The response there, Chairperson, is that the service really depends on the willingness of family members to participate, because ours is really to ensure that we preserve families, but on the other hand, we also ensure that families that are willing to be reconciled, these are the families that we are providing these services. However, we are also saying the department will continue to conduct awareness campaigns and strengthen the implementation of the revised white paper on families that was recently launched by the minister on the 15th of May during your International Day of Families. As we move along, Chairperson, with regards to program or social welfare services, which is Program 2 and 3, there was another question regarding the top-up grant as well. Okay. Then we go to the second quarter performance report. There was also questions with regards to foster care, and the question was, before I go to the one on foster care, what steps are taken to address the deregistration of partial care facilities and duplication of services? And our response here is that as a department, we undertake what we call a developmental quality assurance and as well as risk assessment to ensure that compliance with regards to the norms and standards it's done, and this we do as a prevention measure, so that we are able to see those that do not comply and assist them, and in order to, to avoid deregistration of the facilities. And the second one was how has the introduction of the top-up grant impacted on foster care placements? We then indicate in terms of the response that the impact on foster care placements is that there are less children that are placed through the children's court. We all remember that as a department, for children that needs to be placed in foster care, they have to go through the children's court. So as a result of the introduction of the top-up grant, then there are less children that are now going to be placed under foster care. And to us, it's a positive, because then it means that social workers will be able to provide proper supervision services to children that are in foster care, and make sure that the necessary interventions are provided to such children, a chairperson. So that's what the impact on the top-up child support grant. And that brings us to the end of the responses from program 2 and 3. Thank you, Chairperson.
Was that a non-financial? So can we go to financial responses?
Okay. Thank you, Chairperson. The responses under program 2 and 3, Chairperson, the first question that was asked was with regards to RISIHA program. The question was that, can the department explain in detail what is RISIHA program, who is the service provider, and how the progress is so far in the development of children? Chairperson, this is quite an interesting program that we have in the department. It is a RISIHA program, which is a community-based prevention and early intervention program. This is the program where we focus on vulnerable children, trying to move them from vulnerability to resilience. It's only implemented by qualified child and youth care workers, Chairperson. And in addressing the question regarding the service provider, we have appointed Setabelo Family Care Services from Botshabelo, which is the service provider appointed to implement this program across the province. In terms of the progress so far, Chairperson, we have implemented or are implementing this program in 35 sites across all districts, and to date, 297 child and youth care workers have been appointed by Setabelo to implement this program to our children. And we have reached to date 8,887 children accessing these services. The kinds of services that we are providing there, Chairperson, it's your out-of-school programs, Chairperson. We assist the children, the child and youth care workers do assist the children. They work 24/7, even over the weekends. They assist children with their homeworks. They are referring children to Home Affairs for ID documents. They are providing psychosocial service support services. And I must also indicate that, Chairperson, because they are qualified child and youth care workers, they are also registered with the Council for Social Service Professions. So they are sort of an extension to the social workers. They are mainly placed and based in areas where the department does not have social workers on a daily basis. So they then get all the referrals, and then they provide those to the social workers. They provide, they are what you call their specific domains that are also being followed there, Chairperson. In addition to the child and youth care workers, which the department is providing support, financial support services through the transfers to the service provider. The very same service provider has appointed 5 social workers, Chairperson, from their own budget to strengthen their services and support for the implementation of the program. As we move along, Chairperson, the second one was with regards to the top-up grant again. Can the department explain how much top-up grant is for children under foster care and how is it monitored? Chairperson, the child support grant is 560 rands and the top-up grant is 260. And the total child support grant is 820, Chairperson. I also need to indicate that the top-up child support grant is for is an additional financial aid that is provided to caregivers of orphans and is administered and monitored by SASSA. It was introduced to ensure that vulnerable children grow up in stable environments, so it does not require a court order. This was one of the reforms of the Children's Act, where the department was then required to come up with new solutions because there was a lot of foster care backlog that the department had, where social workers were not able to extend the foster care orders, and this led to a number of litigations. So this reform was then introduced, Chairperson. And the next one was with regard to partial care facilities. The question was, can the department explain how the register of partial care facilities is monitored and by whom, which led to the duplication of services? It was a matter that was picked up in the third quarter, Chairperson, where one of our child and youth care centers, which is also a partial care facility, we discovered during our a developmental quality assurance that there was actually a double dipping, not a double dipping, but the beneficiaries were receiving an allocation both from the daycare center and the child and youth care center. So as a corrective measure, what we then did was to ensure that we then deregister one of the services, the Chairperson. So in this, it was just a corrective measure for us, but the service was not interrupted. The children continued to get a service. It's just that we then, closed down one of the facilities there. But also to ensure that the services also continue within that area, 5 new partial care facilities were registered and funded, and the question was whether did we have budget for that, and yes, we did have budget, Chairperson. We allocated 827,500 to 4 in Thaba Mufutanyana and 1 in Mangaung with the available budget, Chairperson. And that then brings us, Chairperson, I think the last one is the one of Vuka Maulele, which we also reported on, that there was also there was no management committee in that disability center. That is why we had to close down that disability center, Chairperson. And there's also, again, another one on the child support top-up grant, Chairperson. And we are also then saying it's the same reason that top-up grant is not for children under foster care, but it's an additional financial aid provided to caregivers of orphans and administered by the Social Security Agency, Chairperson. Thank you very much.
Thank you very much. I don't assume there are additions this side. In the absence of any, let me take hands from members so that we move with that same speed. Honorable Squabella, any other hand? Looks like it's the only hand.
Thank you, Chair. Thank you, MEC and the HOD and the team. I just want to understand as far as the suspension of the Vuka Maulele Disability Project, that it was suspended based on the mismanagement of funds, but there were no corrective, what we get is that there were no corrective actions or measures taken. Why there were no corrective measures being taken on that particular project? Because when you suspend, the intention is that you suspend with the intention that you ultimately will conclude the matter. You don't suspend and leave it openly like that. But I heard something that there was the management code. There was no management committee. I'm not sure what does that statement, or who was responsible to set up the management committee and why the management committee was not being set up. Just to get an understanding, because it has been suspended, the project, because of mismanagement of funds, but the matter is still not concluded, because you have to suspend, take corrective actions and consequence management, and then we close the matter knowing who's supposed to do, if there were funds that, I'm not sure mismanagement means what, there were funds been lost or been taken, and how was those funds being recouped and so forth. Just to get into details that the department actually, when you have taken a decision to suspend that particular project, you have went to the latter to close the process, as far as including the persons that is responsible, so that what are the corrective measures that you have taken as far as consequence management of those who are responsible in that particular project. Thank you, Chair.
Thank you very much, Honorable Skwevela, and I was slightly worried about the I think it's called Child Foster program or project. When you did not meet the indicators there, but the explanation is, as encouraged by the Act, you want to keep children either in close ties with the family or the relatives. But my question then is, why do we have that as an indicator that comes from your annual performance plan? If you can indicate left and turn right and justify, okay, I decided to turn right when you did not plan to turn right. So that matter, I think it needs to be corrected there. And part of the, I think, impact that I'd like to express is that one here, PEPFAR/USAID, where you seem to have been affected. I think these members of the legislature will acknowledge that we are slightly behind. So we are expecting in the next quarter that reasoning perhaps might stand. Yeah, USAID, that certain things, maybe you've been hit hard by the budgetary cuts, but necessarily that's not as a result of the USAID, because that should find expression maybe in the next, right now, the quotas that we're dealing with, perhaps that's where we should not even be concentrating. However, I'm a bit worried about certain issues that I think perhaps MEC and the team, I should write a question for written reply to your good selves, such that we do not waste much time here. And then I seem like a person who waits in the corner for you to come and somehow attack. Perhaps if I deal with it like that, it shows we want to contribute constructively as the portfolio committee and members of the legislature. So I'll leave it at that. I don't know if there's a member who has a question, and in the absence of any, let me quickly allow the department to answer. Thank you.
Thank you, Chairperson. With regards to the details of Vukamaulele disability in as far as the actual funds, I would request through you and the acting HOD that we then submit a written response. However, with regards to the interventions that have been made, there were interventions that were made regarding training on governance and financial management. This is what the department has done. But in as far as the other details, I think we can then submit a written response. With regards to foster care chairperson, the targets that we had submitted in the annual performance plan were set before the act was amended. So the reform that was introduced in the middle of the financial year. So we had to, as a department, because then immediately, you see the advantage of your top-up child support grant is that it does not require any court processes. So the people that are taking care of the children would then go straight to SASSA to go and apply for a top-up child support grant. So that is why we then saw a decline in the number of foster care placements that the social workers, we had planned for, because it's an sort of an easy way, for the caregivers to take care of the children. There is no court processes. So that is why you see that there seemed to be a decline. And as a result, we then reviewed our target in this financial year, looking at the rate at which the top-up grant is being utilized. Thank you, Chairperson. And with regards to PEPFAR, I think Mayor Nondabula, when she touches on program, on program 4, she will also touch on the PEPFAR. But I can also just indicate that we do have funding that is called the G2G program for the HIV and AIDS, and I think that's the one that has been affected in terms of funding. But Mayor Nondabula would probably touch on that. Thank you.
Thanks, Chairperson. Regarding the G2G program, we, as the department, we are affected. We awarded 4 organizations, but then when they were supposed to get funding, then there was that instruction that no more funding to all the organizations that are in SA. But what we have done as the department, we had organizations, 39 that we have funding, but not for social behavior change. But then for this financial year, what we've done, we allocated funding to all, even those that were funded for social behavior change, that at least they do care and support services to their communities. So we have the budget that we have allocated even to those that were due to get the award for G2G, that is from PEPFAR. Thank you.
Thank you very much. But the last one would then be, when we plan, how it's an annual performance plan, that APP, the allocation of a budget then is based on that, such that you would have even an MEC coming here to debate or program 8 saying, I'd want to give it this much, 8 saying, I'd want to give it this much. Now, we respond to that here in the portfolio committee. So when the act changes, it's a different program altogether. As much as we are legislators, but here in a portfolio committee, we conduct oversight on a basis of the allocation of funds relating to an annual performance plan. So it can't be when the act changes, you change the indicators that were not presented here, and you feel you are not going to deliver, and you think you can slide through the fingers with that, because your act has changed. I don't know if that makes sense. So what was presented before the committee is an APP. That APP was funded, and because of that funding, we'll then run after the money and see where it lands. So you can't say here, I failed to deliver the basis that the act changed, and as such. So I think that disjuncture must be dealt with nicely here, because it's going to land this good department in not so hot oil, but in a hot oil. So I think what we agree on, we must stick to. How, I'm not sure if we are in contradiction with the Act. But you promised us these deliverables, we want them, unfortunately. So that being said, I think that was my wrap up, and I will ask you to continue doing the good work that you've been doing under serious financial constraints. But we see what you are doing, MEC and the team. People who are marginalized, who are downtrodden, at least they find solace and shelter in some of these shelters that you provide us. GBVs, I don't want to dive much into that sketch, but at least you do as much as you can do. We appreciate that. So I'll give MEC to have a parting shot, and so that we can release our good selves. I'm sure you've had a long day there without engaging, so I don't want to hold you a bit longer. MEC?
Thank you very much, Honorable Chair and Honorable Members, once again, including officials present in this portfolio committee. As I always said, that coming to a portfolio committee, it's interesting because one cannot judge himself or herself. Performance needs to be evaluated by someone else or another institution. We are trying our best as the Department of Social Development to do our best within the budget that is provided to us, because there's nothing that we can do which does not have a budget. And we all know that the department serves those that are regarded as the most vulnerable. And the more unemployed people we have, the more burden comes to social development. But we are not complaining. We would endeavor to serve our people and make an impact about the budget that we have. We will try our best because the only thing that we can do is to provide services within the IDP developed by ourselves and the budget provided. And if the APP changes, what we do is a budget adjustment. Now, budget adjustment must also talk to a reviewal of the APP. So we want to thank the Portfolio Committee for inviting us. And we hope that we will do the best that we can to provide services to our people. Thank you very much.
Thank you very much, MEC. The last point that I almost forgot, that I realized that the Chief Whip and my co-chair here, because it's a joint committee, was passionate about in previous committees, a previous department that came here to present, was that we need to improve on collaborative relations, because what you do here affects health, and what health does affects you, and I think the list goes on and on about what Chief Whip calls cooperative government relations, and that must be improved. How, I don't know, but it's got to start somewhere, MEC. So I hope it starts with you. We've encouraged others as well to extend an olive branch that we ultimately is for the benefit of our people. So please keep up the good work and enjoy the rest of the day. Thank you very much. You are dismissed. Maybe I must not adjourn the committee yet. You are dismissed. Thank you very much and enjoy your day.
Dismissed meaning that will never come to a portfolio committee.
Honorable members, and I think I must extend a word of our gratitude to all of you. I don't know if there's anything outstanding that you think we will all die if it's not ventilated here. So that platform is that, it's for that. If Hussein Toba Nabesu, there's not much. We can't force issues if there are none. Honorable Leach, is that the only hand? Thank you.
Thank you, Chair. Just again, to emphasize the reports, I just mentioned to my colleague, it doesn't even help I make notes because it's so old. It's not relevant anymore. So, yeah, and we now discuss the third quarter. We must get the fourth quarter because that has already ended and we need to schedule a next meeting and soon to discuss that and finalize that. And then just a request, we've heard that you have conducted a lot of oversight on your behalf, which I think is a very good thing as a chairperson. But we want to extend an invitation that you're welcome to invite us when you go. And we would, yes, we...
Continue, Honorable Leach. We can't allow Chief Whip to disrupt you. You are still on and highly protected for that matter.
We want to extend an invitation for you to invite us, Chairperson.
I will. I want to step on certain nerves so that certain things come very clear here, so that I realize there's a concerted effort from certain members to protect certain privileges.
Don't get invitation to anarchy.
So, members, we've taken note, we'll draft a report. However, very much, I realize how the departments are confused. When they answer about, like they tell you about PEPFAR and USAID, how Trump has, and what we speak about actually belongs slightly backward, even way before Trump has removed the funds. So somehow, Lorna, we're confusing them, but hey, I know we'll try and improve after the report that we'll submit to the Speaker in Ethics Committee. Thank you very much. The committee is adjourned.